뒤에 포럼의 첫 번째 세션 시작하도록 하겠습니다. 자리를 정리해 주시기 바랍니다. 네, 지금부터 제2회 세계 건강도시 포럼 첫 번째 세션 시작하도록 하겠습니다. 저는 이번 세션의 모더레이터를 맡은 포럼의 집행위원 조인성입니다. 네, 반갑습니다. 이번 세션은 첫 번째 파트 Background of Smart Health Cities, Risks and Opportunities. 첫 번째 세션의 테마는 Strengthening Global Health Security Cooperation for the Next Pandemic이 되겠습니다. 이번 세션은 9시 반부터 11시까지 약 90분간 진행이 되겠습니다. 두 분의 스피커로부터 각각 15분간 강의를 들으시고 난 뒤에 패널 디스커션을 진행하는 것으로 그렇게 하겠습니다. 세션을 진행하기에 앞서서 본 세션의 주관을 맡으신 본 포럼의 바이오메디칼 위원회 위원장이신 사토리스 코리아 바이오텍의 김덕상 대표님으로부터 인사 말씀 듣도록 하겠습니다. 김덕상 대표님 앞으로 나와 주시기 바랍니다.
안녕하십니까. 월드 헬스 포럼 바이오메디컬 위원회 위원장을 맡은 김덕상입니다. 지난 2023년 5월 이후 전 세계가 빠르게 일상으로 복귀했지만 우리는 코비드-19 팬데믹 이전과는 확연하게 다른 사회에 적응하고 대응해야 하는 과제를 안게 되었습니다. 사회적, 경제적 변화뿐만 아니라 코비드-19 이후 계속해서 발생하는 변이 바이러스와 엠폭스 등 인수 공통 전염병의 확산이 전 지구가 맞이한 이 변화가 팬데믹의 종식이 아니라 시작임을 암시하고 있기 때문입니다. 코비드-19에 대처했던 4년이라는 기간 동안 전 세계는 눈앞에 닥친 인류의 위기를 야기한 존재가 다름 아닌 우리 스스로임을 강렬하게 자각함과 동시에 고립과 단절 속에서 사회라는 것이 얼마나 배타적이고 이기적인지를 깨닫게 되었습니다. 그러나 우리에게 필요한 것은 죄책감과 회의에 빠져 있는 것이 아니라 수많은 희생을 바탕으로 한 4년의 경험을 토대로 앞으로의 대응 전략을 수립하는 것입니다. 지난 경험을 통해 전 세계는 팬데믹 상황에서 국경을 수호하는 것이 결코 지속 가능하지 않으며 무의미하다는 것을 배웠습니다. 지구 반대편에서 발생한 전염병이 더는 다른 나라 이야기로만 치부되지 않고 인류에 대한 위협으로 돌변하는 상황에서 전 지구적 협력과 공존은 포스트 팬데믹을 헤쳐나가는 유일한 길이라고 할 수 있습니다. 따라서 본 세션에서는 차기 팬데믹을 대비하기 위한 전 지구적 차원의 공동 대응 전략으로서 글로벌과 로컬이라는 두 가지 중의를 연결시키고자 합니다. 소외된 지역과 국가에 선진화된 보건 인프라를 확충하고 보급하는 것은 감염병으로부터 이들을 보호하는 동시에 차기 팬데믹을 예방하는 방법일 수 있습니다. 글로벌과 로컬은 결코 분리될 수 없으며 두 층위 간의 상호 연결은 궁극적으로 모두를 위한 인간 안보를 확보하기 위한 필수 전략이 될 것입니다. 실제로 여러 국가가 공중보건 위기 대응 역량을 강화하기 위해 협력하고 있습니다. 그 구체적 사례와 성과 및 아이디어의 공유에 관해 중앙정부, 지자체, 보건단체, 기업 등 각 분야의 전문가들을 모시고 차기 팬데믹을 대비하기 위한 글로벌 및 로컬 보건안보 전략에 대한 보다 심층적인 논의를 이어가도록 하겠습니다. 바쁘신 와중에 참석해 주신 모든 분들께 유익한 시간 되시길 바랍니다. 감사합니다.
네, 김덕상 대표님 말씀 감사합니다. 그럼 본격적으로 세션에 들어가도록 하겠습니다. 말씀드린 대로 두 분의 스피커를 저희가 준비를 했습니다. 이번 세션의 중요성에 맞춰서 인도네시아와 라오스의 굉장히 중요한 분들을 저희가 스피커로 이렇게 했습니다. 먼저 처음 말씀해 주실 분은 인도네시아의 대통령 자문위원을 지내신 간디 술리스티안토 씨를 소개해 드리겠습니다. Mr. 간디, please.
Very good morning to everybody. Distinguished guests and World Health City Forum. My name is Gandhi Sulistianto. I am the former ambassador of Indonesia to Republic of Korea. It is a privilege to be here at this prestigious event, surrounded by the respected expert in the healthcare industry. This forum is especially significant as we continue to face global health challenges, underscoring the importance of partnership and share knowledge. As the saying goes, to be the best, we must learn from the best. I'm eager to take advantage of the insights shared by all the experts here to enhance our collective strategies for addressing the changing landscape of the global health. Reflecting on my experience during my tenure as ambassador here, I witnessed the strengths of collaboration between our two great nations, Indonesia and South Korea. Just last year, we celebrate 50 years anniversary of diplomatic relationship between my country, Indonesia, and Korea. a milestone that reflects our shared commitment to mutual growth and support. Recently, our journey has been challenged by the COVID-19 pandemics, which reminded us of how interconnected our countries truly are. A health crisis in one country can quickly affect regions across the globe. We all remember the isolation, the restrictions, and the adjustment we made of our daily life to protect ourselves and each others. As we gather here, I'm reminded that the profound impact that the COVID-19 pandemic had on each of us. We witnessed the vulnerability of even the most advanced healthcare system, but we also observe extraordinary resilience and adaptability. In response to unprecedented challenges, personally, the pandemic served as a time of reflection, emphasizing the importance of preparedness and cooperation, among other things. Thus, it became pretty clear that health is not just an individual pursuit, it is a shared responsibility. Looking ahead, in today's agenda on strengthening global health security cooperation for the next pandemic, we have a unique opportunity to explore innovative approach to global health challenge. Together, we can elevate our collaboration to new heights, preparing our health system to face future crises with resilience and unity. As we reflect on recent global health crises, it becomes clear that health threats know no borders. From densely populated cities to remote villages, every community was affected in distinct ways. But the solution must not be one size fits all. To truly protect health across the globe, we must embrace global approach, combining the strengths of global knowledge and with the local actions. Having said that, today's symposium provides a valuable opportunity to explore how international organizations, governments, and communities can work together to defend against future pandemics. We must forge strong connection, ensuring all healthcare systems are prepared and well-equipped. During COVID-19 pandemic, we saw a remarkable example of global cooperation, from research sharing to vaccine distribution. Organizations like the World Health Organization, alongside national government and private entities, works tirelessly to address global needs. However, the pandemic also highlighted gaps such as a vaccine inequity, resource limitation, and various response strategies across countries. What I just mentioned is precisely what we must anticipate for the future. We need to address past shortcomings and turn our weaknesses into strengths that can withstand upcoming global crises and other challenges. In addition, we must shift our focus from merely responding to a proactive prevention and preparedness. This is very important. Proactive prevention and preparedness. Think of as preparing for a natural disaster, those stocks for the long term will fare better. The key word here is proactive. Waiting is not an option. We must be proactive in creating sustainable health infrastructure to withstand future challenges. This means investing local healthcare facilities, strengthening supply chains, and ensuring that healthcare work receive necessary resource and training. Another crucial consideration is the need for sustained funding to support the public health systems. Governments and private sector must work hand in hand to allocate resources not only to immediate pandemic responses, but to the long-term strengthening of healthcare system. This means establishing emergency reserves and enhancing rapid response mechanism and providing continuous training to healthcare workers. While this initiative may seem demanding, they are essential for proactive readiness, positioning us to confront not only today's health threat, but also those to the future. By investing strategically a resilient healthcare system, today we will ensure a robust, well-equipped response to whatever challenges lie ahead. So far, technology has played an indispensable role in the pandemic's response, from contact tracing to telemedicine. This digital solution have enabled us to monitor outbreaks, track vaccines, and provide remote care. Moving forward, we need to invest in adaptable health technology that are both accessible and scalable, especially for underserved regions. By expanding their reach, we can ensure that more communities benefit from timely, effective healthcare solutions. In addition, enhancing early warning system and establishing robust global health standards are crucial for future preparedness. Early warning system thus equipped with advanced data analytics and real-time monitoring will allow us to detect health threats at the earliest stage and respond swiftly and minimizing their impact. Ideally, the system should be integrated across countries, enhancing their effectiveness and ensuring truly coordinated global response to tackle health emergency before they escalate. Equally important is setting up clear global health standards. These standards create a common approach for health practices, covering everything from disease tracking and reporting to vaccine distribution and treatment methods. However, they must also be adaptable to local methods and conditions so as to ensure effectiveness in diverse settings. By establishing straightforward, flexible guidelines, we make it possible for countries of all resources levels to respond quickly and synchronize when new health threats arise again. Health is not a personal matter, but a shared responsibility to human beings. Protecting public health requires involvement for everyone, from policymakers and healthcare workers to the private sector and individual citizens. Building trust within communities is essential so that people feel confident in the health measure being taken. With trust, we gain the compliance and support needed for initiatives that protect us all. In closing, I want to express my deep gratitude to each of you for the work you do so far. Your effort contribute not only to the health and safety of your own communities, but also to the global community. The symposium we are part of today is a sign of hope, showing that by working together, we can overcome the challenges ahead. Let us keep collaboration and find new innovation so that we can emerge from this period stronger and more united in our approach to global health. Together, we can make sure that we will be ready when the next health crisis comes on one resilient global family. So again, I appreciate for the organizing committee which organize two-day meeting until maybe the next 2 days. It is really important for everybody to work together globally. Thank you, Hamsamida.
네, 감사합니다. 간디 술리스티안토님 감사드립니다. 다음에 두 번째 스피커를 모시겠습니다. 두 번째 스피커는 현재 라오스의 보건부 장관님이시고 아세안의 라오 PDR 의장을 맡고 계신 분팽 장관님을 소개해드리겠습니다. Mr. 분팽, please.
Good morning, everyone. Thank you for inviting me to speak today about how we can strengthen global health security cooperation. Cooperation between sectors and across countries is vital to prevent and responding the acute public health threat. We best strengthen global health security when we work together to address challenges. Through this presentation, I will highlight how we can strengthen our cooperation efforts with a focus on the efforts of ASEAN and example from my home country of Lao People Democratic Republic. We need to be ready to respond to a wide range of threats. Threats to health security are wide-ranging, including infectious diseases, natural disaster, chemical and radiation events, and conflicts. On the screens are examples of acute public health events faced in recent years from across ASEAN member countries. This includes recent public health emergency of international concern, COVID-19 and Mpox. It is important to remember that these threats can also happen simultaneously and have included many events that require multi-sector collaboration, such as zoonotic diseases, such as avian influenza, natural disaster response, humanitarian crisis, vector-borne disease outbreak in a new area. The challenges we face in our past response hold the key to strengthening health security and coordination in the future. Response to health security threats has its challenges. We have all experienced the challenges of translating and operationalizing existing preparedness and response plans to adapt the new public health events. This is a particular challenge when bringing together sectors who do not routinely work together in order to coordinate a response. Significant resources are required to facilitate an effective, timely response. Acute events, particularly large-scale events, require a network of trained workforce who can surge to fulfill all key functions. This pool of workers may not always be available. Financial resources are also an important consideration and a challenge for many contexts to make available rapidly to support response. Another challenge is how to maintain essential health services while resources are focused on the emergency response. We need to ensure that the delivery of these essential services is maintained, but this can be difficult when there are limited resources available. The pandemic also highlighted the importance of sharing information effectively and coordinating between countries. It is critical to share lessons learned and best practices between countries to rapidly respond to health emergency. These challenges countries have faced in the past hold the key to strengthening health security and coordination in the future. We need to include all relevant sectors to effectively respond to health security threats. Many health emergencies require coordination of multiple sectors to understand the situation, identify appropriate response measures, conduct joint investigation, and responses effectively. Multi-sectoral information sharing is important in peacetime and especially during public health emergency. All relevant sectors therefore need to be trained in public health emergency management and engaged during response. Including all sectors during emergency operation center meetings is crucial to ensure that all areas are updated and we have a coordinated response. Training our health and non-health workforces is also important. Joint training in public health emergency management help non-health sectors to understand they have a role to play in health security and to strengthen coordination. Development of clear policy and emergency planning will facilitate preparedness and more effective response during emergency. Clear policy establish roles and responsibility enabling efficient communication and collaboration among different sectors during emergency. Well-defined emergency plan outline the strategies and response for health security threats, including the resources needed. Lao PDR developed the National Health Security Work Plan to describe the achievement, remaining gaps, priority action for the country to ensure the core health security capacity required under the international health regulation. Exercise and trainings help ensure that the staff are prepared and know what to do during a health emergency. Strengthening health security begins with a strong local workforce. Strengthening health security begins with developing and maintaining a strong local workforce. Field epidemiology training programs to improve workforce capacities for outbreak investigation, public health surveillance, and epidemiological analysis. A multi-sector approach to threats enables strengthening across sectors, including public health, animal health, laboratory, and clinical workforce. This helps to build health security capacity across sectors and to build relationships to assist in coordination and collaboration in emergency response. A strong health system in routine times is necessary foundation for a strong health system during emergency. Our ability to respond during emergency is shaped by the strength of our existing systems. A strong, resilient health system is therefore a necessary foundation for a strong emergency response. This includes the capacity to maintain infection prevention and control measures, routine surveillance, a strong laboratory network to collect and test specimens, and capacity and resources in clinical management to treat patients. Having this system in place in the country will help ensure that we can prevent, detect, and respond to health security threats. Community engagement and trust is an essential investment for effective response. Lack of trust between villages and the health system leads to limited access to care, vaccine hesitancy, poor maternal and child health outcomes, and low trust in health providers. During COVID-19, initiatives to empower local communities to enhance trust, ownership, and leadership regarding health were strengthened in Laupedia. This increased trust has contributed to increased births at the healthcare facility and use of antenatal care and higher vaccination rates. We need to check how we are going to target areas for improvement. In all areas I have discussed and in health security more broadly, it is important to regularly review our progress. This helps us to identify what is working well, where there may be gaps in our health security efforts, and help to plan areas for improvement. Regular review is particularly important where we have limited resources, enabling us to better prioritize our health security efforts. Laupedia will conduct its second joint external evaluation in March 2025, which will be an opportunity to improve health security in the countries. Frameworks like the Asia-Pacific Health Security Action Framework provide countries in ASEAN with a guide to taking a whole-of-government approach for health security and recognize the importance of monitoring and evaluation to strengthen health security core capacities. International networks like ASEAN are effective platforms for information sharing and capacity building. In addition to building national health security capacity and coordination, we should also consider how we can better coordinate between countries. We share common challenges and can learn from each other's experiences to continue to improve health security. ASEAN has been an effective platform for regional coordination towards strengthening health security of countries in this region. ASEAN regional networks provide a space for shared collective intelligence and share best practices and lessons learned from multiple countries. This enables us to identify new strategies to strengthen health security and coordinate information sharing and response. ASEAN has also facilitated joint training and simulation exercise to build and maintain national capacity and strengthen cross-border coordination efforts. 5 non-tech survey in the future. Strengthening health security begins with effective preparedness planning, resilient system implemented by a strong workforce. Public health emergency impact multiple sectors and multi-sector coordination is a crucial, including community engagement. Coordination across countries and regions provides opportunities to share information and learn from each other, strengthening global health security. Thank you.
네, 본팽 장관님 강의 잘 들었습니다. 혹시 이 플로우에서 궁금하신 내용 질문하실 분 있으면 한두 분 받도록 하겠습니다. 혹시 질문하실 분 계십니까? 네. 없으시면 다음 순서로 넘어가도록 하겠습니다. 다음 순서는 이제 스피커 시간이 끝나고 다음에 패널리스트 6분을 모시고 패널 디스커션을 진행하도록 하겠습니다. 패널 디스커션은 본 포럼의 체어이신 서울대 홍윤철 교수님께서 진행해 주기로 하였습니다. 패널 6분께서는 이 패널의 그 좌석 시트가 준비되는 대로 앞으로 나와주시기 바랍니다. 패널 6분은 캄보디아에서 보건부에서 오신 명 바나롬, 그다음에 임병택 시흥시장님, 이종구 서울대 교수님, 알리킴 WHO 대표, 또 SK바이오사이언스의 폴김 부사장님이십니다. 앞으로 나와주시기 바랍니다. 네, 이제 패널 디스커션 준비가 된 것 같습니다. 좌장님과 패널 분들은 앞으로 나와주시기 바랍니다.
Thank you very much. Following the great talk of two speakers, previous session, now we are going to move to roundtable discussion following the previous talks. I'm Yoon Chol-hong, the chair of World Health City Forum. It's very nice to have really great panelists and all the audience today. I'd like to express my gratitude for the presence of diverse voices from government, healthcare, academia, and industry in this roundtable panel discussion to set a tone by reiterating the critical need for collaborative action across both global and local levels to bolster health security. We need to focus more on dialogue, on practical steps, challenges, and innovative approaches for pandemic preparedness. Today, we are privileged to have a distinguished panel of experts who bring diverse perspectives and valuable expertise from their respective fields. I will encourage our panelists to actively exchange ideas, propose actionable solutions, and address real-world issues that might not only impact national health security, but also resonate at the community level. So now, as you see, we have a great, the 5 panelists in this round table. So I'd like to introduce briefly our panelists first. The right to me, the Honorable Cambodia Vice Minister of Health, Mr. Muong Panarom. Right to him, Mayor of Siheung City, Mr. Byung-taek Lim. Right to him, Emeritus Professor of Seoul National University, Dr. Jong-gu Lee. Right to him, Representative and Head of Country Office WHO, Macedonia, Ali Akim. Right to him, the Vice President of SK Bioscience, Paul Kim. So as you see, this is a fantastic panelist from central government, local government, academia, international organization, and private sectors. So we have really very wonderful panelists. So firstly, I would like to give questions, the common question to all panelists, the same question. So my question, the first is, I'd like to ask a question to all panelists. What are the most significant lessons we have learned from recent pandemic, COVID-19? I hope the Honorable Vice Minister of Cambodia, the first.
Okay, thank you very much, moderator. Very good morning, Excellency, ladies and gentlemen. Especially good morning, Excellency Bun Peng, Minister of Health, Lao PDR, and also the Chair of the ASEAN Health Minister. and very good morning, all the panelists. Thank you very much for the question. You know, with regard to the recent history of outbreak, especially for the COVID-19 outbreak and other health emergency, you know, Cambodia has been actively working to enhance its health security, particularly on the response to the global health challenges. Here are some key aspects of the Cambodian current health security situation. I'd like to highlight 5 points. Yeah, first, the recent health event. You know, since 2023, Cambodia has faced multiple health threats, even including avian influenza, mpox, dengue fever, methanol poisoning, and annual floods. This incident underscores the necessity for robust health security measures. Second, Cambodia, you know, conducted the second JEE, we call a joint external evaluation, which is the, you know, comprehensive assessment of health security core capacities. This voluntary, collaborative, and multi-sectoral effort aim to identify areas for improvement in national health security system. The first JEE in Cambodia, you know, was completed in 2016, with a second evaluation just finished recently in 2024, demonstrating enhanced capacity in critical areas such as surveillance, national laboratory system, health services provision, infection prevention and control, called IPC, and emergency response management. And the third, you know, health security situation in Cambodia, the COVID-19 response. You know, Cambodia has a revamped its COVID-19 response strategy to tackle new challenges, including more transmissible variant and decreasing cases numbers. The government has prioritized evidence-based strategy to suppress transmission, minimize social disruption, and protect the population. High vaccination coverage has been a cornerstone of this response. And the fourth situation, international support. You know, organizations such as the WHO, World Health Organization, and the United States Agency for International Development, USAID, have supported Cambodia health security effort. This support includes training health and border staff, improvement IPC measures, and assisting the return of migrants during the pandemic. And the final you know, point is about the challenges and risks. Rapid and ongoing climate and environmental changes, along with economic shocks, are increasing health hazards and heightening health risks. Cambodia efforts to enhance health security and ongoing with significant progress in strengthening health system for preparing for the future health emergency. I like also highlight the, you know, experience in Cambodia to the successful, you know, fighting with the COVID-19 and also the health emergency. I'd like to highlight 6 short form. The first one is the political leadership and strong commitment of the government. And the second experience is clear management mechanism. And the third one, as mentioned by Excellency Minister of Laos, Dr. Bun Peng, and also from the Indonesian, about the trust and participation engagement of the community. And the fourth one, also raised by the Excellency Minister, about the whole society engagement, including the active participation, facilitation, and support from all national and sub-national institutions, private sector, and key local and international development partners. And the fifth one, the coordination and cooperation mechanism, globally and regionally. And the last one is the continuous and consistent health education and risk communication. Yes, thank you so much.
Thank you very much for your great talk, Vice Minister. 다음으로는 우리 또 시흥 시장님의 말씀을 듣도록 하겠습니다. 같은 질문입니다. 우리가 지난번 팬데믹에서 어떤 교훈을 의미 있는 교훈을 얻었는가 하는 질문에 대해서 말씀 주시기 바랍니다.
네, 저도 옆에 우리 그 패널님께서 말씀하셨던 것처럼 시흥시가 겪었던 일을 쭉 이렇게 말씀드리는 걸로 그렇게 하겠습니다. 네, 2020년 1월 20일이었습니다. 대한민국 코로나19 확진자가 발생한 이후에 3,400만 명 이상의 국민이 감염되었고 3만 5천 명이 넘는 사망자가 발생했습니다. 우리 시흥 시민도 약 70% 되시는 분들이 코로나19를 경험하셨고요. 코로나19 장기화를 통해서 불안과 그리고 경제적 어려움까지 함께 감수해야 했습니다. 우리 시흥시는 시민 공무원, 의료진들과 함께 감염병 대응에 총력을 다했습니다. 코로나19 지원체계 강화 그리고 감염병 관리과 신설, 조직체계 정비, 비상방역 대책반 운영 등을 통해서 감염병 대응에 집중을 해왔습니다. 특히 확진자가 발생한 곳에 시흥시장 현장 사무실을 운영해서 마을 방역과 더불어 방역 물품, 주민 상담 등을 제공하며 지역민들을 안심시키는 행정을 펼쳤습니다. 또한 경찰, 군인과 협업해서 24시간 비상근무 체계를 유지하며 지역사회 전파를 최소화했습니다. 우리 시흥시는 전국 최초로 자기기입 역학조사 시스템을 도입해서 신속한 역학조사를 가능케 했고 감염 취약시설을 대상으로 한 방문 접종 그리고 집단 환자 발생 시 코호트 격리 등 즉시 조치한 성과 등이 있습니다. 이외에도 권역별 예방접종센터를 설치해서 시민과 미등록 외국인에게 신속한 백신 접종 기회를 제공하며 빈틈없는 방역을 펼쳤습니다. 시흥시는 이번 코로나19 대유행을 통해 축적한 경험을 바탕으로 앞으로도 감염병 재난 상황에 대비하기 위한 감염병 재난 현장 조치 행동 매뉴얼을 제작하고 일상 속에서 지원 체계와 역량 강화를 위한 노력을 이어가겠습니다. 시흥시는 팬데믹이라는 어려움에 직면하면서 급증하는 감염병 환자 관리를 위한 지방정부의 역할을 재확립할 필요성을 느꼈습니다. 국가 방역을 성공적으로 운영하기 위해서는 지역사회가 평상시 방역 활동에 책임지고 훈련과 위기 대응 매뉴얼 정비에 집중해야 합니다. 대응 인력의 역량 강화에도 힘써야 합니다. 특히 지역사회 내 의료시설, 소방서 등과 협력해서 감염병 관리와 위기 대응 계획을 마련하고 이를 정비할 필요가 있습니다. 팬데믹은 정부의 대응만으로는 막을 수 없고 또 신종 감염병은 언제든 재발할 가능성이 큰 만큼 지역사회는 책임 있는 대응을 할 수 있는 안전망을 구축해야 한다고 생각합니다. 팬데믹 초기에는 중앙부처와 지방정부 간 정보 공유가 원활하지 않아서 많은 혼란이 발생했었습니다. 향후 팬데믹 대응에 있어서는 지방정부의 1차적인 책임을 명확히 규정하고 각 지역 특성에 맞는 방역 체계를 갖출 수 있도록 제도적 장치를 마련하는 것이 꼭 필요합니다. 그리고 지방 재난 관리 정보화 시스템 구축, 전문 인력 양성, 대응 능력 강화 등을 위한 프로그램 개발도 꼭 필요합니다. 이러한 노력들이 지방정부와 중앙정부 간의 협력체계 강화를 통해서 안정적인 팬데믹 대처에 가능한 정책들이 될 것이라고 생각합니다. 예, 감사합니다.
네, 감사합니다. 임평택 시장님. 특히 이제 중앙정부와 지방정부의 책임과 역할의 정리, 그다음에 협력 체계를 만들어가자, 이런 아주 좋은 말씀을 주셨습니다. Next, we are going to have Professor Jong-gu Lee with the same question.
Thank you, Chair. First, I'm pleased to be here and would like to thank the organizers for these meetings. Our country has learned from the COVID-19 outbreak that cross-border control only cannot guarantee countries has security. First of all, I would like to say about that this pandemic and the recent outbreak of measles during pandemic highlight how a local public crisis is interconnected with global health issues. After the initial outbreak in China, the first commonplace Republic of Korea was reported on January 20, followed by 30 cases by February 16. The increase in confirmed case was limited to 1 or 2 per day. However, on February 18, the 31st confirmed case emerged and the situation began to escalate uncontrollable. This individual has no history of overseas traveling and no any contact with travelers, but he was confirmed to have attended religious meetings. Epidemiological investigation revealed that this patient has already been infected by a patient from the Wuhan who attended the same religious meeting and was super spread. He was a super spread the infection to others. As a result, contact tracing and testing was conducted on all individuals who attend the religious meeting in Daegu area, identify a total 5,200 people infected. We contact tracing more than 200,000 people. By March 10th, our country has the second highest number of cases outside of China, and at the point, the highest number of cases for capita globally. In response, many countries close their border against the Republic of Korea and restrict the export and the import all materials, including personal protective equipment. However, we made great effort to the rapid tracking, testing, and isolation. The end of July, the daily case has significantly dropped to single digits. The other case of measles, since COVID-19, low-income countries have experienced reduced vaccination coverage leading to outbreak of vaccine-preventable disease, such as measles. Measles emerged in countries previous certified for measles elimination due to migrations. While endemic area, with low vaccine rate, continue to see outbreaks in need to the supplementary immunization activities. Measles underscore the importance of raising vaccine level to herd immunity for the national security. They highlight the need for international cooperation in exchange of these information, such as pathogen DNA sequence outbreak regions and drug resistance, and in regional surveillance and response efforts to prevent where infected case cross borders lead to localized outbreak. In conclusion, we need 8 focus area for the strengthening the health system. One is public health emergency preparedness. Second is surveillance, risk assessment, and response. Third is laboratory capacities, and we need more knowledge about zoonosis. 5, preventing through health care for the people's risk communication, for the fake news, regional, the Asia area preparedness alert systems and the response. The last one is monitoring and evaluation. This is learned from the outbreak of measles, the pandemic, the COVID-19. Thank you.
Thank you very much, Professor Jongkuri, for sharing the idea of what we need to prepare for the possibly coming pandemics again. So now we will have Ali Akim for the same question, please.
Thank you, Professor Hung, and good morning to you all. The Vice Minister and the Mayor and Prof have outlined a long list of lessons learned. Those are very, very important lessons. If I could just take 2 steps back, for me, one of the biggest lessons from the pandemic is that our health is connected to virtually everything else. And I think the Mayor said it, the economic insecurity, the anxiety that people experienced, and the challenges to our ways of life kind of really shined during the COVID pandemic, which therefore means that the connection between the global south and the global north, between the most vulnerable and the least vulnerable, is really, really important when we think about the way we act around the health system. So, investment in public health systems is critical. I think that is a powerful lesson that the pandemic taught us. The second bit that I want to highlight very quickly is about our communities. Our communities matter. That's where things happen. And people can trust the tools that we have, vaccines or not. They can trust the information we give or not. They can engage in actions that will help reduce transmission or not. So therefore, the work we do with the community, even before the pandemic, to prepare and to have an agreed way in which people engage with local authority, national authorities, become extremely important. It would be incomplete to think that technology didn't play a very big role in our response. Technology was quite important. Positively, on one hand, so being able to offer care to people through telehealth and telemedicine. However, technology was also a challenge for us in terms of spread of misinformation, in terms of ability to govern the way we use data for patient care, confidentiality, security of, and privacy of data within the health system. So what I'm really saying is that we have to already prepare before we have the threat. And look at technology, look at the way we work with our communities, invest in the right infrastructure. I think the mayor talked about healthcare workforce, but I think even the logistic workforce, the sanitary workforce, become extremely important. If I may, the last thing I would emphasize is what the mayor talked about in terms of accountability and roles and responsibilities. And I think for me here, there's one other layer, which is the kind of partnerships that we form as we prepare to respond to pandemic or any other public health emergencies. We have to go beyond traditional partners. We have to think about the private sector. We have to think about the non-governmental sector, civil society as we call it, and of course, philanthropy and all of that. Quite a good amount of the support we have in developing the tools like vaccines that helped us during the COVID pandemic came from the work of researchers, bioscientists, philanthropy, civil society. And so having a formidable partnership that is focused on how to support our communities, I think would be another lesson that I think we learned during the pandemic and the way we responded. Thank you.
Thank you, Ali Hakim, for sharing the idea what we need to think about to defend against the pandemics. So now we will have Paul Kim for the same question. What are the most important, significant lessons we have learned from recent pandemics?
네, 안녕하세요. SK 바이오사이언스 김바른 부사장입니다. 저희는 이제 여기 혹시 SK 바이오사이언스가 익숙치 않으신 분들 계실 것 같아서 잠깐 소개드리면 SK라는 회사는 한국에서 두 번째로 큰 회사이고요. 저희는 SK 바이오사이언스로서 백신 컴퍼니입니다. 저희가 이렇게 초대받아서 너무 영광인데요. 아마 초대해 주신 이유가 있을 것 같아요. 백신 컴퍼니답게 저희가 팬데믹이라는 기간 동안 나름의 역할을 좀 했던 것이 있었고 그거에 대한 경험담을 조금 공유해 줄 수 있는 기회가 되기 때문에 초대해 주신 거라고 믿습니다. 가장 큰 레슨은 벌써 한 3년 전이네요. 가장 큰 레슨은 저희가 백신과 치료제가 없었다는 거였습니다. 초창기에. 기억하시겠지만 처음에 어떻게 치료를 해야 될지 어떠한 백신을 맞아야 될지도 굉장히 혼란스러웠었죠. 근데 저희는 당시에 백신이 없었습니다. 안타깝게. 그래서 저희는 그 치료제와 백신을 확보해야 되겠다라는 범정부적인 차원 그리고 회사로서도 그러한 커미트먼트를 갖게 되었습니다. 근데 아시겠지만 백신이라는 것이 갑자기 만들어야 되겠다 그래서 딱 만들어지는 것은 아니죠. 통상 저희 업계에서 얘기할 때 백신을 개발하려고 그러면 10년 걸린다고 하고요. 1조를 투자해야 된다고 하고요. 그리고 성공 확률은 1% 미만이라고 얘기합니다. 근데 저희가 처음에 이러한 제안을 받고 이러한 생각을 했을 때 가장 첫 번째 저희한테 스스로에게 했던 질문은 우리가 과연 만들 수 있을까? 우리가 그러한 기술력을 갖고 있을까라는 의구심이었습니다. 그리고 관련된 투자할 수 있는 여력이 있을까? 사기업이니까요. 또 이런 것들이 수익이 창출될 수 있을까? 여러 가지 고민들을 많이 했었습니다. 근데 저희가 21년도에 처음 시작을 했고요. 23년도 9월 달에 백신을 만들게 되었습니다. 전 세계적으로는 치료제하고 백신을 갖고 있는 세 번째 국가가 됐죠, 한국이. 저희는 그 자체만으로도 굉장히 영광스럽게 생각을 하고 있습니다. 근데 기술력 이외에 저희가 내부적으로도 항상 강조하는 게 있습니다. 그 선한 의지라고 저희 내부에서는 명명하는데요. 굿윌이 필요한 것이죠. 당장의 수익이 창출되지 않지만 전 세계 보건 의료를 위해서, 국내 보건을 위해서 어떻게 기여를 할 수 있을까? 또는 저희가 그동안 받았던 여러 혜택에 어떻게 빚을 갚을 수 있을까라는 것으로 출발을 했습니다. 저희는 독감 백신, 바리셀라 백신, 수두 백신이죠. 대상포진 백신 여러 가지 포트폴리오를 갖고 있는 한국에서 제일 큰 백신 회사 중에 하나입니다. 근데 저희가 코로나 백신을 만들려고 하니까 만들 수 있는 캐파와 여력이 안 되는 거예요. 저희 그래서 공장에 있는 알토란 같은 독감 백신 사업을 2년 동안 중단하기로 했습니다. 이게 사실 굉장히 쉽지 않은 결정이잖아요. 독감 백신은 시즈널 백신이고 항상 공급할 수 있고 그거에 대한 수익이 항상 보장돼 있는. 그러나 저희는 과감하게 2년 동안 그 독감 백신 사업을 중단하였습니다. 왜? 한국에는 독감 백신을 생산할 수 있는 여러 회사가 있었기 때문입니다. 그러나 저희는 그걸 포기하고 코로나 백신에 전념을 하게 되었습니다. 사기업으로서는 참 결정하기 어려운 순간이었는데 저희로서는 글로벌 커뮤니티 헬스를 위해서 나름의 큰 결정을 할 수 있었습니다. 백신을 확보했고요. 그리고 백신에 대한 기술을 확보했고요. 또 무엇보다도 중요한 건 백신 글로벌 네트워크의 일원으로 활동할 수 있었던 큰 경험을 얻었습니다. 잘 아시는 바와 같이 백신은 개발부터 공급까지 글로벌의 키 플레이어들이 있습니다. 사기업 이외에도 WHO가 있고요. 세피가 있고요. 가비가 있고요. 그 이외에 정말 많은 저희도 사실은 팬데믹이 아니었으면 경험할 수 없었던 여러 플레이어들과 함께 할 수 있었습니다. 소위 혹자는 이런 걸 이너서클이라고 얘기하기도 합니다. 그리고 백신 대통령들이라고 얘기하는 그러한 글로벌 플레이어들이 있었습니다. 그분들의 조언을 들었고 재정적인 지원을 받았고 여러 저희가 백신을 개발하는 데 과정에서 정말 많은 힘을 얻을 수 있었습니다. 사실 그런 파트너십이 없었다면 저희는 불가능했을 거라고 생각을 합니다. 글로벌 이외에도 이 자리를 빌어서 다시 한번 저희 백신을 개발하는 데 있어서 힘써주신 정부 관계자분들한테 정말 감사드릴 수밖에 없습니다. 저희가 백신을 개발할 수 있을 때까지 10년이 걸릴 백신을 2년 만에 만들 수 있을 때까지 정말 각 분야에서 아낌없는 지원과 제도적 많은 응원을 받을 수 있었습니다. 저희는 이제 그 경험을 바탕으로 넥스트 팬데믹을 준비해야 될 텐데요. 그런 부분들을 또 저희가 쌓았던 노하우들 다시 한번 잘 정리하고 있습니다. 결론적으로 주신 질문에 대답을 다시 한번 정리하자면 가장 큰 레슨은 백신이 있어야 되겠다라는 걸 깨달았다는 것. 치료제든 뭐 말할 것도 없고요. 그럼 백신을 어떻게 만들 수 있느냐? 그 기간을 어떻게 단축할 수 있느냐? 그 많은 예산을 어떻게 확보할 수 있느냐? 파트너십이 없으면 불가능합니다. 그 파트너십을 그 팬데믹이라는 전쟁 속에서 몸소 체험했다라는 것들이 굉장히 큰 저희한테 걸음이고 레슨이라고 할 수 있겠습니다. 감사합니다.
네, 감사합니다. SK 바이오사이언스 또 백신에서의 기여 크다는 것을 다시 한번 확인을 하였습니다. Now we have a really time constraint, so I hope the second round must be 2-minute talk from each of you based on the previous the questions I circulated already to you. So please use 2 minutes for your thoughts to share with the audience. Please.
Thank you very much. Thank you again, Chair, Moderator of the session. Yeah, the question was about the gap in pandemic preparedness framework between high-income and low-income countries. I think these are very significant and multifaceted challenges. So I just highlight the 7 key different. The first one is health system infrastructure. You know, for the high-income country, more robust health system with better infrastructure, including the hospital, laboratories, and trained health care personnel. And for the low-income country, often struggle with inadequate facility and a shortage of healthcare workers. And the second key point is the funding and resources. We see that for the high-income country, they have more financial resources to invest in pandemic preparedness, including the research, development of medical countermeasures and emergency response. For the third point about the access to medical countermeasures, for the high-income country, they have better access to vaccine, treatment, and personal protective equipment, while the low-income country, have often experience delay and shortages in accessing these critical resources. For the fourth point about the surveillance and data systems. For the high-income country, we see the typical, they have more advanced surveillance and data system to detect and monitor outbreak quickly, while the low-income country may lack the necessary technology and infrastructure for effective surveillance and data collection. The fifth point is about the international support and collaboration. For high-income countries, they often have the stronger international partnerships and support network, which can provide additional resources and expertise during pandemic. The sixth point is about the public health workforce. For the high-income country, they have larger, more specialized public health workforce, which is crucial for pandemic preparedness and response. The last point about the policy and governance, when the high-income country often have more established and effective public health policy and governance, while the low-income country may face challenges in implementing and enforcing public health measures due to weaker governance and policy frameworks. So in order to addressing these gaps, require concerted effort from the global community, including increased funding, technology transfer, capacity building, and stronger international cooperation. By working together, we can help ensure that all countries are better prepared to face future pandemic. Yes, thank you.
Thank you very much. 다음에는 우리 임병택 시장님, 그 건강한 도시를 만들기 위해서 원대한 계획을 갖고 계신 걸로 알고 있는데 간단하게 소개 부탁 말씀드리겠습니다.
네, 우리 시흥시는 60만에 가까운 인구가 있는 도시입니다. 당장은 우리 공준보건력에 대한 말씀들을 많이 하시는데 우리 시흥시 보건소를 중심으로 한 우리 건강정책의 그 활성화가 정말 중요할 것 같고요. 우리 공중보건을 담당하는 보건소 중심을 통한 시민들 참여 프로그램 정책 개발과 확산이 또 중요할 것 같습니다. 우리 시흥시 같은 경우에는 매달 한 번씩 원하시는 시민분들과 함께 시흥시대의 걷기 운동을 통해서 시흥시에 대해서도 알고 스스로의 건강도 챙기고 또 정보도 공유하는 그런 프로그램이 있는데 바로 그러한 게 한 사례이지 않을까 싶습니다. 보건소도 우리 시흥시 권역별로 이제 있습니다만 각 동마다 배치되어 있는 또 우리 간호 인력들을 통해서도 우리 동사무소와 가까운 곳에 계신 시민분들을 위한 보건 정책을 알리고 확산하는 데도 중요한 것 같습니다. 결론적으로 말씀드리자면 팬데믹을 겪으면서 정말로 그 지방정부, 중앙정부뿐만이 아니라 지방정부의 감염병에 대처하는 이 보건행정의 중요성을 절실하게 느꼈고 이를 기반으로 넥스트 팬데믹도 대비해야 되겠지만 우리가 살아가는 일반 삶 속에서도 더 건강한 삶을 누리기 위해서 시민들이 참여하는 다양한 건강 프로그램과 함께 어우러지는 그런 도시로 만들어 가고 싶습니다.
네, 감사합니다, 시장님. 이어서 프로페서 정구리, what lessons we have for the collaboration of global and local levels?
this pandemic makes us to ask the role of WHO and the role of international organization and the role of each countries for the preparedness and response for the next pandemic. Above all, response should base on the evidence and the science base, and the implementation also based on the budgets and the law. That is very important. And also we need international cooperation. If there is no international cooperation, it's difficult to control this kind of disease. So I said to 7 points about strengthening the health systems and the protection of health for the people. So first one, how exactly the virus spread to human? That required the investigation, especially if there were any potential leakage from the research facilities. We need to examine whether security measures at each facilities are adequate. And why there was a delay in the implementation mask wearing measure for the preventing the human-to-human transmission in this outbreak? WHO do not recommend the mask wearing in early stage. Overall, we need the science-based, the evidence-based policy. That is very important point. Second one is the preparedness. Why are there inadequate the preparation for the movement restriction and the border closure? Sometimes each country do not allow to the import of protective equipment, which is necessary for COVID-19 equipment, which means violates the IHR Article 43. We need to amend the IHR. We cooperate to the cross-border control and export-import of the PPE and the necessity for the COVID-19 outbreak response. Third area is strengthen the health system and achieve the universal health coverage required fund. There is a challenging for the low-income countries. Are there any alternative method, alternative solution? Maybe new convention framework for the global health, such as pandemic prevention treaty, will cover the problems funding. Fourth is there is insufficient preparation and response to address the issue of equitable access to vaccine and the treatment drugs, PPE. New convention might secure the medical countermeasures for each country and equally. Fifth, there is a need to develop the effective model for manpower development, particularly in areas like contact tracing, primary health care, and home-based health care. New skills such as telecommunication and the personal skills, adaptive skills must be needed in the health workforce. 6, reflection is needed on whether equitable support and protection were provided for the vulnerable group in context of the poor. This pandemic prolonged more than 3 years, then make not pandemic, but syndemic. As mentioned by the Richard Horton, poor people suffer from their economic and the other things. Last one, is there a reasonable approach to prevention of human rights, violation for the individual, suspicious of infections? Some countries contact tracing isolation that is not based on the law. Most of these human rights restrictions must be based on the law. We need a framework for the human rights. Thank you for your attention.
Thank you for the really deep thoughts about wanting to prepare. To Eliakim, I would like to ask you a brief talk about what strategy we need for the global health security.
Thank you. I'm very conscious of time, so I'll keep it brief. First, I think it's got to be about harmonized and coordinated effort from the global level through to the national level and then the local level. What that means in practice is that the local level should be able to create an action plan that is based on the national plan, which is based on the global plan, the international health regulations, and any of the global frameworks that would be pertinent to whatever issue we're talking about. I like the experience in Korea, where there's a national plan for environmental health protection, but then each local government is meant to create its own action plan and indicators. That's one very specific way to actually make those big global agenda real on the ground. Without funding, you can have as many plans as you want. So funding becomes extremely important. So how do we create a sustainable funding at a local level? It would mean what the mayor was saying earlier on, that roles and responsibilities are clear. Therefore, local government should be able to raise funds through local taxes or local revenue generation efforts that can then be allocated to those very clear action plans that are costed. I think nothing would happen locally, if I'm keeping it short and just focusing on things to emphasize from what Prof was saying. It's the work with the community. And at the local level, that's where we know the community best. So finding the community leaders, the opinion formers, the political leadership, the civil leadership within the local level that is then able to translate those costed action plans into what matters to their local villages, local towns, local families, I think would be very important as well. And the local government is right at the center of that and probably the best place to make that happen. So if you've got that coordination from global through national to local, you could make a lot of difference and be very well prepared and have a resilient system that can respond to pandemics. Thank you.
Thank you very much. So lastly, not least, 폴킴 부사장님, 아까 말씀은 해주셨지만 결국은 정부하고 프라이빗 섹터의 협력 관계를 어떻게 강화할 것이냐가 큰 숙제인 것 같습니다. 말씀 부탁드립니다.
네, 정부와의 파트너십이 너무 중요하다는 걸 저희가 팬데믹 기간에 절실하게 느꼈죠. 단순히 제도적 지원뿐만 아니고 또 저희 정부에서도 여러 가지 금전적이라고 할까요? 재정적인, 간접적인 지원들을 많이 해주셨습니다. 또한 저희가 글로벌하고 커뮤니케이션 하는 데 있어서도 굉장히 중요한 브릿지 역할도 또 해주셨고요. 반면에 기업으로서 저희는 이제 글로벌 무대로 계속 진출을 하려고 하는 회사이다 보니까 아까 말씀드렸던 소위 말하는 이너서클, 키 인플루언셜 피플들하고 커뮤니케이션을 하면서 또 한국의 백신, 한국의 위상을 나름의 위상을 위해서 역할을 하려고 노력을 해왔습니다. 그런 것들이 결국은 또 넥스트 팬데믹을 준비하는 데 있어서 저희가 그 키 무대에 올라갈 수 있는 하나의 원동력이 되더라고요. 이런 과정을 저희가 이제 겪으면서 정부의 협조, 글로벌 이니셔티브의 협조가 굉장히 중요하다라는 것 다시 한번 강조드립니다. 사실 정부가 지금 이제 또 넥스 팬데믹이 도래한다라는 것은 많은 전문가들이 이미 예견을 하고 계시기 때문에 정말 많은 노력을 하고 계시는 걸로 알고 있습니다. 여기 계신 분들 잘 아시겠지만 알파 H라는 거를 이스태블리시해서 새로운 R&D의 영역을 좀 펼쳐가고 계시고요. 특히 mRNA 백신이 굉장히 중요하다라는 큰 레슨이 있었기 때문에 정부에서도 과감한 투자를 지금 시도하고 계신 걸로 알고 있습니다. 저희 역시도 거기에 이제 키 플레이어로서 어떻게 참여할 수 있는지를 지금 계속 고민을 하고 있는 상황입니다. 정부에서의 이러한 선제적인, 그다음에 금전적인 다음 넥스트 팬데믹을 준비하는 그러한 노력에 다시 한번 이 자리를 빌어서 감사를 드리고요. 저희로서는 말씀드렸다시피 백신 컴퍼니이기 때문에 그러한 니즈, 글로벌 헬스를 위해서 하루빨리 단 하루라도 먼저 백신을 만들어서 공급해야 할 의무가 있습니다. 그것들은 저희가 그 사이에 정부하고 커뮤니케이션, 글로벌 이니셔티브하고의 커뮤니케이션, 그것과 별개로 저희가 저희의 실력, 역량을 계속 키워나가야 된다고 저희는 생각을 하고 있습니다. 방금 짧게 mRNA에 대한 얘기를 말씀을 드렸는데 저희는 이미 앞서 말씀드렸던 세피로부터 지원을 받아서 일본 뇌염 mRNA 백신을 개발을 하고 있습니다. 지금 일상에 이제 들어갔고요. 그러한 노하우들이 또 축적이 돼서 다음 팬데믹이 왔을 때 빠르게 저희가 대체할 수 있는 플랫폼을 지금 이미 구성을 하고 있습니다. 이러한 것들이 기존에 저희가 받았던 그러한 레슨들, 그리고 아까 말씀드렸던 파트너십 스피드, 거기에 한 가지 더 한다면 기업 자체적인 노력이 굉장히 필요하기 때문에 이런 것들이 위기 상황이 도래했을 때 다시 한번 하모나이즈 될 수 있는, 파트너십으로 맺어질 수 있는 그러한 준비들을 하고 있다는 말씀드리고 각자 위치에서 잘 역량을 키워나가는 것이 되게 중요하다고 생각합니다. 감사합니다.
네, 감사합니다. I'd like to thank you all of the panelists for the active participation. I think this discussion reminds us necessity of a collective commitment to building a more resilient and equitable global health system. Thank you all for the insightful contributions of our distinguished panelists, and I hope the dialogue today will translate into impactful action in the years to come. Thank you very much for attending this session. I will close this session. Thank you for all.
네, 감사합니다. 오랜 시간 첫 번째 세션 무사히 잘 마쳤습니다. 오늘 참석해 주신 스피커 여러분들, 또 홍윤철 위원장님을 비롯한 여러 패널분들 감사드리고 끝까지 경청해 주신 청중 여러분께 감사드리겠습니다. 이번 첫 번째 세션 마치도록 하겠습니다. 감사합니다.
Distinguished guests, ladies and gentlemen, welcome to the second World Health City Forum. Allow me to introduce myself. My name is Soa Kwon, and it's my absolute honor to be your MC for today's meaningful event following the inaugural World Health City Forum last year. Let me greet you. Thank you very much. First and foremost, I would like to express my heartfelt gratitude to all the distinguished guests, speakers, and citizens attending the second World Health City Forum here in Songdo, Incheon, South Korea, under the theme Urban and Planetary Health, How to Make Smart Health Cities. The health of our planet, the home to all life, is still closely connected to the life of humanity. However, the industrialization and urbanization pursued by our species have led to pandemics and unprecedented climate crises, dramatically changing all aspects of our lives. Now is the time for us to recover and restore the health of our planet and build sustainable cities that can coexist with other life forms. Now, this is a global forum where representatives from central and municipal governments, international organizations, academia, and the private sector gather together to build sustainable, resilient, and healthy communities. I sincerely hope that the second World Health City Forum will lead to a bold transition to smart health cities worldwide through greater collaboration based on last year's Incheon Declaration. And now I would like to introduce our distinguished guests who have graced this occasion with their valuable presence. As I call out each of their names, please greet them with a warm round of applause. First, we are pleased to welcome President Kim In-mi of Ewha Women's University. Thank you very much. And we have Boonfeng Pumalaisit, the Minister of Health of Lao PDR, here with us today. Thank you. Abdullah bin Hamad bin Abdullah Al Attiyah, Qatar's Minister of Municipality, has attended. Thank you very much. And next we have Ha Il-soo, President of the Korea Foundation for International Healthcare, with us. Thank you. And Mayor Im Byung-taek of Siheung City is also here with us today. Thank you very much. And Mayor, we also are going to welcome Im Taek, Chairman of the Korea Healthy Cities Partnership. Thank you very much. Some of our distinguished guests may still be on our way. Now, I would like to also continue to note the resilience to recover from ever-growing pandemics and climate crises and to create environmentally sustainable and smart communities is a concern for all the stakeholders around the world. And we are honored to have distinguished representatives from leading international organizations, including UNCDF, UNDRR, and GCF, as well as key officials from 11 countries, such as the former Advisory Council to the President of Indonesia, the Ministry of Health from Cambodia, the Department for Local Diplomacy Facilitation from Vietnam, the Deputy Permanent Secretary of Public Health from Thailand, and the Ministry of Health from Tanzania. We also have esteemed representation from the mayors of Vientiane in Laos, Luang Prabang, Izumisano in Japan, and the deputy mayors of Qingdao and Zhonghai in China, as well as the deputy mayors of Ulaanbaatar in Mongolia and Choibalsan are participating, along with over 70 officials from a total of 18 overseas local governments. Furthermore, we are pleased to welcome more than 100 speakers from 30 countries. Now, due to time constraints, I apologize for not being able to introduce each one of them individually, but I think this would be a great occasion that we all give a warm round of applause to all participants and speakers who are committed to collaborating and supporting the transformation to smart and healthy cities around the globe. Thank you very much. And now, ladies and gentlemen, we are going to have Professor Hong Yoon-chul, the chair of the Executive Committee, who will deliver the opening declaration of the Second World Health City Forum, marking the beginning of this remarkable journey. So let's welcome him with a big round of applause.
Good afternoon, distinguished guests, colleagues, and esteemed participants. Welcome to the World Health City Forum. It is truly an honor to be here with visionary leaders, innovators, public health experts, urban planners, and representatives from across sectors, all united by a shared commitment to build healthier, more resilient, and more inclusive cities for all. Today, we found ourselves at a pivotal moment. Cities around the world are facing unprecedented challenges. They are rapid urbanization, climate change, population growth, and of course, the enduring impact of recent health crisis. As more people move into urban areas, the urgency to design cities that prioritize health and well-being is greater than ever. In many ways, our cities represent both our greatest opportunities and our greatest responsibilities. This forum is more than just a gathering of experts. It is a call to action. We are here not just to exchange ideas, but to forge actionable strategies that can transform cities into thriving, health-centered ecosystems. Our discussions over the coming days will span a range of critical issues, that is, integrating health into urban planning, utilizing data and technology to monitor and manage health, and addressing health inequities so that no one is left behind. We'll explore not only what it takes to create health-centered cities, but also how we can do so equitably and sustainably. It is our mission to build environments making health and wellness accessible and sustainable, attainable for all, regardless of background or economic status. It calls for us to value partnership with communities, governments, private sectors, and international organizations, and to break down silos that hinder progress. As chair of the forum, I'm deeply optimistic about what we can achieve. Together, let's reform our cities into a vibrant space where health, resilience, equity are at the forefront. Let this forum be a catalyst for meaningful change that resonates far beyond these words. Thank you all for being here, and I look forward to the impactful conversations and strategies that will emerge from our work together. Welcome once again to the World Health City Forum. Now, I declare the opening of the forum. Thank you very much.
This Earth, once a giant furnace filled with carbon dioxide, has become our home, sheltering the mystery of life and the miracle of evolution. The health of our planet is still closely connected to the lives of humanity, but humans have been pursuing a path of development that is the opposite of the health of the Earth. The human race, which gathered together in cities to find safe communities, and became citizens, abused nature, causing the extinction of other species and sending the carbon that the Earth embraced back into the atmosphere. The planetary health was drained as the cost of building cities. Now cities are the heartbeat of our lives, and to prevent cities from collapsing, we must develop and build healthy, smart, sustainable, and resilient urban environments. Industrialization and urbanization, which have negatively impacted our planetary health, have led to a crisis of pandemics and unprecedented climate disasters. And as a result, all aspects of our lives are undergoing significant changes. What can we hope for now? There is no time to regret. Now we must restore life through wisdom and collaboration in the face of a climate crisis that will only accelerate and a pandemic that will occur again. There is no time to regret. We must create sustainable communities and cities that protect the health of the Earth and coexist with other life forms. We must all join together to create a sustainable city with a healthy Earth, resilient and safe communities, and digital technology that serves people. For us and future generations.
Cities indeed are the heartbeat of our lives. A strong message in the theme video that once again demonstrates why we are all gathered here today. And on that note, we would like to hear from some distinguished personalities for congratulatory messages. And the first congratulatory message will be by Ban Ki-moon, the chairman of the Better Future Foundation and also former UN Secretary General, who is actively supporting this forum. He was scheduled to join us in person to honor the event, but due to an unavoidable schedule change, he has sent a video message. So let's watch the video from Chairman Ban Ki-moon together.
His Excellency Bun Pheng Phom Malesit, Minister of Health of Lao PDR and Chair of the ASEAN Health Ministers Meeting, His Excellency Abdullah bin Hamad bin Abdullah Al Attiyah, Minister of Municipality, the State of Qatar, Professor Samuel Myers, Johns Hopkins University, Dr. Hong Yun-chol, Chairman of the Executive Committee, Second World Health City Forum, Excellencies, distinguished guests, ladies and gentlemen. It is my great privilege to deliver this video message on the occasion of the opening of the World Health City Forum 2024. I am delighted to address this gathering, which brings together so many brilliant minds and hearts committed to addressing one of the most pressing challenges of our time. In this regard, I believe the theme for this year, urbanization and planetary health, how to make smart health cities, could not be timelier nor more important. As the 8th Secretary General of the United Nations, I have seen firsthand how our rapidly urbanizing world not only drives but shapes global development. Indeed, cities are not only places where people live and work, they are the engines of growth, innovation, and opportunity. Yet, they also represent the front lines of our greatest challenges: climate change, public health crises, inequality, and the degradation of our natural ecosystems. The question before us today is very critical. The answer lies in our collective commitment to sustainable urbanization, which is at the heart of the United Nations Sustainable Development Goals, SDGs. The SDGs provide us with a comprehensive blueprint to achieve a better and more sustainable future for all. Cities are central to this vision. Over half of the world's population now lives in urban areas, and by 2050, this number is expected to surge to nearly 70%. In view of this, the choices we make today in how we plan, design, and govern our dynamic cities will determine whether we can achieve the SDGs, particularly goal number 3 on good health and well-being, goal number 11 on sustainable cities and communities, and goal number 13 on climate action. However, cities are not simply drivers of economic progress. Unfortunately, they are also at risk themselves. Poor air quality, inadequate healthcare infrastructure, rising inequalities, and climate-induced disasters are threatening the health and prosperity of urban population. If we fail to address these challenges urgently, we risk undermining the SDGs and jeopardizing the future of billions of people. To realize this essential vision, we need cooperation and partnership, both across sectors and borders. Governments, the private sectors, civil society, and international organizations must work together in unprecedented ways. The United Nations is deeply committed to this multi-stakeholder collaborative approach, and I take this opportunity to urge all of you present today to engage in forward-thinking partnerships that drive real impact. This forum is a timely opportunity to bring fresh ideas and innovative solutions to the table. We must learn from each other, share best practices, and take bold action to ensure our cities become beacons of health and sustainability. In this connection, the World Health City Forum 2024 represents both a discussion and a call to action. Let us harness this vital moment to reimagine the role of cities as catalysts for human and planetary health. Excellencies, distinguished guests, ladies and gentlemen, this is a pivotal year and decade for our cities, for humanity, and for our Earth. Let us thus seize the moment and make the decisions today that will shape a healthier, more inclusive, more resilient, and more sustainable future for all people and our planet. I reiterate my heartfelt congratulations on the realization of this World Health City Forum 2024 and look forward to the inspiring conversations and practical solutions that will emerge from this event. Thank you for your attention.
Thank you very much to Chairman Pan for those words and also for highlighting the need for collective action and collective commitment by all of us. And next, we will have a congratulatory speech from Minister Boonfeng Pumalaisit of Lao PDR, the chair of ASEAN in 2024. Now, following last year's video message, this year, Minister Boonfeng has traveled all the way here to support the forum in person. So please welcome Minister Boonfeng with a huge round of applause.
Honorable delegates, distinguished guests, Ladies and gentlemen, on behalf of the Minister of Health, Lao PDR, and as ASEAN Chair in 2024, it is a privilege to extend heartfelt congratulations to all gathered here today for the opening of the World Health City Forum 2024. This prestigious event in Incheon stands as a testament to our shared commitment to advancing health, resilience, and sustainability within urban environments worldwide. Today, as an ASEAN Chair, we celebrate not only our progress, but our deepening partnership in pursuit of a healthier, more resilient ASEAN. Our region's journey toward health-focused, sustainable cities is strengthened by forums like this, which bring together global perspective, innovative solutions, and a unified vision for the future. Under Lao PDR's leadership within ASEAN in 2024, we are dedicated to promoting a holistic, people-centered approach to health development. This aligns closely with the goals of the World Health City Forum, where we seek to inspire and drive forward transformative health strategies that empower our communities and uplift the well-being of our urban populations. We commend the Republic of Korea for hosting this important gathering and for its role as a valuable partner in the ASEAN region's health initiative. Together, through our ongoing collaboration and shared commitment, we are creating cities that not only foster wellness, but also serve as beacons of innovation, resilience, and inclusion for all. Congratulations once again to all involved in organizing this forum. May the discussion here spark meaningful change, guiding us toward a brighter, healthier future across ASEAN and beyond. Thank you for your attention.
Thank you very much. Let's give another big round of applause to Minister Boonfeng Pumalaisit, and thank you very much for your meaningful words and again for being here with us for the forum in South Korea. And ladies and gentlemen, we are going to have a final speech that will be given by Minister Abdullah bin Hamad bin Abdullah Al Attiyah of the Qatar Ministry of Interior. So please, let's welcome him with a big round of applause. Now, the minister's remarks will be interpreted from Arabic into English only. So if you had your channels on channel 1, please switch them to channel 2 unless you understand Arabic. 네, 장관님의 축사는 아랍어에서 영어로 통역이 될 예정이오니 채널을 2번으로 바꿔주시면 감사하겠습니다.
Distinguished guests, just for your surprise, I'm going to give my speech in English, just to give it a change of scenery, if you know what I mean. Distinguished guests, first, I am pleased to be in Incheon City, participating in the World Health City Forum. On this occasion, I would like to express my sincere thanks and appreciation to the Mayor in the Republic of Korea for hosting the World Health City Forum 2024. I would also like to thank the World Health Organization and the organizers of this forum for their efforts in organizing this significant international event and wish them the very success. Your Excellencies, the agenda of this forum highlights the challenges and the risks facing cities today and the need to enhance cooperation in the field of global health security to confront any future pandemics. It also addresses the health city strategy, the response to climate crisis, and innovation in health to align with international vision and evolving global dynamics. In this context, the state of Qatar had joined this event to promote health, equity, and sustainable development through innovation, multi-sectorial transformation, community engagement, and integration of health into all policies aiming to enhance well-being, ensure equity, and prevent major cause of disease. Qatar is proud to have become the first country in the world to have all its municipalities classified as healthy city by the World Health Organization. This classification reflects Qatar's commitment to providing health and sustainable environment for its citizens and residents through the development of implementation of the Health City Program. Qatar's Health City Program is a strategic initiative under the health in all policies priority of the National Health Strategy for the State of Qatar 2018-2022, which aligns with the Qatar National Vision 2030. The program also supports the National Development Framework, which aims to create cities that are more livable, healthy, and open for work and learning. This program was based on 4 main pillars: establishing a strong governance structure, community participation and empowerment, behavioral changes intervention, and finally enhancing the performance monitoring and evaluation. The State of Qatar has hosted the Eastern Mediterranean Health Cities Conference from 31st of October to 2nd of November 2023, under the theme, Healthy Cities, a multi-sectorial approach to health and well-being. In this regard, we must strengthen cooperation between national and international authorities and allocate sufficient resources and efforts to support this goal. Finally, I would like to thank all that is involved in this forum, His Excellency the Mayor of Incheon City, the organizers of the forum, and all the participants, and I wish them the very success. Thank you very much. Thank you.
Thank you very much. That was Abdullah bin Hamad bin Abdullah Al Attiyah, the Minister of Municipality of Qatar. Let's give him another big hand. I was wondering why I suddenly understood everything. There seemed to be a slight misunderstanding. Thank you very much for that speech in English, of course. Not in Arabic, so thank you very much once more. And with that, I would like to again express my gratitude to all the distinguished guests who gave these congratulatory messages. Now, we would like to wrap up the opening ceremony to mark this momentous occasion by capturing a commemorative photo with our distinguished guests and speakers before we move on to the keynote speeches. So we are going to set up this stage now, and we kindly request for the audience for a brief moment. Bear with us just a moment until we have all the stage set up, and our esteemed guests and speakers may start to join us on the stage. We will have our staff guide you onto the stage so that we can have the commemorative photo. So as we get the stage ready and also our distinguished guests onto the stage, let me give you a little bit of information on the proceedings today. After the opening ceremony, we're going to have keynote speeches by renowned experts, and that will be followed by the World Health City Forum Summit, where we're going to have another in-depth discussion with a number of panelists. And following that, we will also have a breakout session, and that is going to complete the day. So we have a fully packed schedule here today at the Second World Health City Forum. So let me now slowly ask our distinguished guests to join us for the commemorative photo. I believe we have a number of guests, around 40 of guests that will have to join us. So maybe our staff could guide them onto the stage now as we are about to get ready for the photo. All right, and please come up to the stage now. Please welcome them with a big round of applause. All right, it looks like we have just enough space for all of our distinguished guests. All right, now please smile into the camera with a big smile. 1, 2, 3. And you know, we like to do this at forums. We like to say fighting in Korean. So please raise your right fist into the air and look into the camera. By 1, 2, 3, we're going to shout fighting together. All right? 1, 2, 3, fighting! Okay, last but not least, let's end with a big round of applause. Okay, thank you very much again to our distinguished guests. And with that, we would like to ask you to please return to your seats. So with that, we have wrapped up the opening ceremony to mark this special occasion by capturing a commemorative photo. And we are soon going to officially begin with the Second World Health City Forum after we get the stage ready again. And once we're arranged, we're going to start in a few minutes. So please wait just a few more minutes until we begin officially with the Second World Health City Forum. All right, it looks like we are having a little mini photo session here at the front. Now, ladies and gentlemen, we are about to begin with the second World Health City Forum in earnest. So let me remind you once more, for those who need interpretation for the sessions from now on, please set your receiver to the channel of preference. The Korean channel is 1 and the English channel is 2. 네, 이제 본격적으로 시작을 하도록 하겠습니다. 다시 한번 통역 안내해 드리겠습니다. 채널 1번은 한국어, 채널 2번은 영어입니다. Now, the theme of this forum is urbanization and planetary health, how to make smart health cities. What should we consider and hope for in order to transition to smart and healthy cities and communities that promote sustainable coexistence and health for humanity and other life forms on our home planet Earth? I hope we all gain insights on the direction of this significant transformation, international efforts, and the tasks assigned to all of us from the two experts who will be giving today's keynote speeches. So if everyone is ready, we would like to invite our speaker for the keynote speech. So I would kindly ask our guests to take your seats that we can proceed. So let me introduce our first keynote speaker, who is Dr. Samuel Myers, the founder of the Planetary Health Alliance and a professor at the Johns Hopkins Bloomberg School of Public Health, who leads a global movement on planetary health. The Planetary Health Alliance is a consortium involving over 450 universities, NGOs, research institutes, and government entities from more than 75 countries, committed to understanding and addressing global environmental change and its health impacts. Dr. Samuel Myers' keynote speech is titled Planetary Health, Protecting Humanity on a Rapidly Changing Planet. So let's welcome Professor Myers with a huge round of applause.
All right. Thank you so much. It's really an enormous honor to get to be here with all of you today. And I want to start by expressing deep gratitude to our hosts and the organizing committee and the many co-sponsors of this meeting for bringing us all together. I also want to thank all of you, my distinguished colleagues, for making it a priority to come together both in person and online to engage in this really critical discussion. And I think it is fair to say that this discussion is critical. There's a strong argument to be made that the future of humanity and the rest of life on Earth depends on our success in achieving what we're here over the next couple of days to discuss: planetary health cities. Let me see if I can figure out how to advance my slides. We come together today in a time that is truly, I think, a unique moment in human history. There's never been another moment like it. By most metrics, there's never been a better time to be a human being. The last 75 years or so have shown extraordinary improvements in many metrics of global human development. Adult literacy in that time has doubled. The percentage of people living in extreme poverty has fallen from 62% to less than 10%, despite a tripling of the global population. Life expectancy has risen from an average of 46 to 72. and global child mortality has fallen by a factor of 5. These are truly extraordinary achievements. But the same exceptional improvements in science and technology that have fueled these almost unimaginable improvements in human development in essentially one person's lifetime have also been fueling what many of us call the Great Acceleration, the rapid expansion of humanity's impacts on our natural systems. And all of these metrics of our consumption patterns globally over time show very similar trends. And not surprisingly, similar metrics of our impacts on our planet's natural systems also show similar trends, with relatively modest impact on our planet's natural systems through about 1950. And then this very steep acceleration up through today. And the reason that all of these curves look so similar is that they are all underlain by the same fundamental trends. The growth of the human population, which again was very stable for most of human history, and then started to rise around 1900, a little bit more steeply around 1950, and then this very, very steep growth in the number of people who share the planet with us. And at the same time, an even steeper growth in per capita GDP and the amount of goods and services that each one of us is asking the planet to provide. And when you multiply those two trends, you get this ballooning of global GDP such that we sit now on an almost vertical curve, this explosion in what humanity is asking of our planet. It's hard to overstate the extent to which our activities now collectively shape the entire biophysical conditions of the Earth system. We use about 40% of the terrestrial land surface for our croplands and pasture, about half the accessible fresh water, mostly to irrigate those crops. We fish 90% of monitored fisheries at or well beyond their maximum sustainable limits. We've cut down around half the tropical and temperate forests in the world, dammed well over 60% of our rivers, and are now suffering from a growing problem of pollution of air, water, and soil at a global scale. As you all know, we're disrupting the entire climate system, and all of these different kinds of environmental change are now driving species extinct at about 1,000 times the baseline rate. The population sizes of things like birds, mammals, reptiles, amphibians, fishes that share the planet with us has fallen by about 2/3 since 1970. Of all mammalian biomass on the planet, the entire mass of mammals on the planet, 32% or 34% is us. 62% is our livestock. 4% is wild mammals. So we've become a dominant force shaping and threatening the systems that hold our planet together. This is a tragedy in its own right, this Earth crisis, and our degradation and dismantling of our planet's natural systems, but it has reached a scale and a pace that has become a clear and present danger for the survival of us as a species as well. The core premise of the field of planetary health is that the scale of the human enterprise now exceeds our planet's capacities either to absorb the waste that we're producing or to provide the resources that we're using sustainably. And as a result, our activities collectively are transforming not just the climate system, but all of the dimensions of an interconnected Earth system. Global pollution, biodiversity loss, altered biogeochemical cycles, changes in land use and land cover, resource scarcity are all interacting with each other in complex ways that we just are starting to really understand, but that affect the foundational conditions for human health and well-being, the quality and quantity of food that we produce, quality of air and water, our exposure to infectious diseases and extreme weather events, even the habitability of many of the places that we live. And as a result, we're seeing significant burdens of disease now around the world across every single dimension of human health. Just as many of us have led research over the last 2 or 3 decades showing that there are very important social and cultural and political determinants of health, we're now coming to understand that there are critical ecological determinants, that our health is nested in the Earth system. And as we begin to transgress the planetary boundaries across the entire Earth system, we're seeing more and more impacts. Many of you will be familiar with other frameworks besides planetary health. The climate health framework, for example, that really looks at one dimension of Earth system change and asks how that dimension is affecting health. But in some ways, it's an incomplete conversation because climate change isn't taking place in isolation. It's taking place in the context of all of these other kinds of simultaneous change that are underway. Similarly, the One Health conversation, which adds a critical dimension to our understanding about how changes in our relationship with wildlife and domesticated livestock leads to zoonotic infectious disease transmission, and how spillover events, like presumably the one that drove the COVID-19 pandemic, can occur in response. But again, it is a dimension of a larger planetary health framework. I want to briefly give you a sense of how this is affecting our health, since that's the core focus of this conference. And as I said, it's affecting every dimension of health. In nutrition, this was our great success story, right? Decade after decade after decade, we'd been improving global food security despite a rapidly rising population, until around 10 years ago, when all of a sudden that trend reversed. And this was pre-COVID, pre-Ukraine conflict, and we started to see the numbers of people who are food insecure around the world climb again, and we continue to see that. And many of us are concerned that one of the things that's causing this reversal is the headwinds represented by destabilized biophysical conditions. In my own research, we've found that rising concentrations of carbon dioxide in the atmosphere are making our food significantly less nutritious, robbing staple food crops like rice and wheat and maize of critical nutrients like iron and zinc and protein, and potentially pushing hundreds of millions of people into new risk of micronutrient deficiencies. We've also found that insufficient wild pollinators as part of the biodiversity crisis is driving about 500,000 excess deaths every year because we don't have enough pollinators to optimize the production of fruits and vegetables and nuts, foods that protect us from things like heart disease and stroke. And so we see the increased mortality. Infectious diseases are exquisitely sensitive to these biophysical conditions. I talked about the COVID pandemic and spillover events, but it's not only pandemics and spillovers. Vector-borne diseases like malaria or schistosomiasis are very responsive to changes in land use. Cholera is very sensitive to changes in precipitation. And we're seeing all of these changes as a result of our own activities. So across the board, infectious diseases and their exposures are changing. The non-communicable diseases are significantly impacted as well. It's estimated that somewhere around 8 million deaths occur every year from particulate air pollution alone. The Global Pollution and Health Report, published a few years ago, estimated about 9 million excess deaths from air, water, and soil pollution. So these are very large numbers, mostly from non-communicable diseases associated with pollution. We all know that heat exposure and many other factors are increasingly driving our exposure to the non-communicable diseases as well. And mental health is something that we're only just starting to really understand. But the mental health epidemic around the world is in part being driven by ecological grief and eco-anxiety, particularly in the younger generation. Recent surveys suggest that up to about a half of people aged 16 to 25 in both wealthy and poor countries report feelings about climate change negatively impacting their daily life. This is in addition to the extreme mental health impacts of the sort of extreme weather events that we're seeing, the major fires, tropical cyclones, etc. And then finally, we're seeing steadily rising numbers of displaced people. Obviously, this is very complicated and multifactorial, but every year for the last 10 or 12 years, we've seen the records break for the number of displaced people globally. We're now well over 100 million displaced people. Over half of them are children. And destabilized biophysical conditions, severe droughts, for example, are one of the factors that's driving population displacement, which of course has very large health effects and can lead to conflict. Across all of these health impacts is a critical issue of social justice. The people who tend to bear the burden of degraded natural systems are the poorest people in the world, indigenous peoples, non-human beings, and future generations. While the people who tend to be most responsible for these changes are the wealthiest people in the world and their consumption patterns. This is deeply unfair. So this is where we find ourselves gathered together in this moment. We, as healthcare professionals, can no longer do our jobs. We can no longer safeguard human health into the future while the natural life support systems that all of us depend on are starting to crumble under the weight of our own ecological footprint. As we sort of take stock of that reality, the only thing that makes sense is to figure out how we reduce that ecological footprint and bring our species back into some sort of balance with our planet's natural systems so that we can protect and regenerate the life support systems that we depend on. How do we move upstream and change the way we're living and change our systems so that they're more efficient and more protective? The good news is that as we look out across all our systems, whether it's food systems, energy systems, the built environment, circular economy, manufacturing, we see an extraordinarily rich landscape of solutions. The answers are out there. It's really a question of political will. There's an enormous amount that we can do. And one of the most critical areas that we need to be thinking about is urban design, what brings us together today. If most of the human population will be in cities and the major demographic trend is urbanization, how do we design those cities to optimize physical and mental health while minimizing the ecological impact of their inhabitants? And really, I would argue at every scale, and this is not my field of expertise, so I'm not going to say a lot here, but I would argue that at every scale, from buildings to neighborhoods to municipalities, there are enormous opportunities to become more efficient and more ecological in how we design our cities, the materials that we use, our energy use, our water efficiency in our buildings, and the use of green spaces, designing neighborhoods with cluster zoning and active transport, thinking about the local food system, the need for green space to bring people together and address both mental and physical health and social connectedness, and density to reduce our reliance on automobiles, which allows for the active transport. And at the municipal level, what are our energy sources? How do we think about solid waste management and water treatment? The need for public transport, thinking again about the entire food system and the need for biological corridors. So there's so much that we can do. And I think it's extraordinarily exciting that we're coming together to think about smart, healthy cities in the context of planetary health. If we can start to get this right, if we can develop principles for planetary health cities and agree on them as a global community and begin working with local governments to implement those principles, we have a chance at reversing the trajectory that we're on. I also want to invite any and all of you to participate in the Planetary Health Alliance. You can join as member organizations or as individuals. We'll be having the next big annual meeting in Rotterdam next October. And with that, thank you for your attention.
Thank you very much to Dr. Samuel Myers for your insightful speech, that is, and it really emphasized how the rapid changes in Earth's natural system caused by human activities are returning impacts on human health, and that our way of life also must undergo rapid transformation in response to the situation. So why don't we give Dr. Samuel Myers another big hand for that wonderful keynote speech. And now for our second keynote lecture, we will be going online abroad. So let me introduce our next speaker. Professor Alistair Woodward from the University of Auckland will be focusing on cities and climate change. Professor Alistair Woodward, who specializes in medicine, public health, and epidemiology, has been an author for the IPCC, or Intergovernmental Panel on Climate Change, for the past 20 years. And serves as the co-editor of the International Journal of Epidemiology. So please give a warm welcome to Professor Alistair Woodward, who will be presenting live from New Zealand.
Well, thank you. Thank you very much for that introduction, and distinguished guests and organizers of the meeting. Thank you very much for giving me an opportunity to talk to you. Let me share my slides. Right, quick tour around my laptop. Thank you very much, Dr. Sellers, for that opening talk. I enjoyed that very much. That painted the big picture of what it is that we are grappling with. I'm going to talk just about a thin slice, really, of that big challenge that you gave us, which is talking about climate change specifically and the part that cities play. Now, this point has been made already by many of the speakers, but it's such an important one. I think it's worth repeating, you know, that cities are simultaneously the major source of the problem, 75% perhaps of greenhouse gas emissions released from urban areas, but they are also our biggest hope, I believe, for rapid and effective climate action. And in a few minutes, I'm going to speak about the example of London, led by Mayor Sadiq Khan. Now, when city leaders talk about climate action, adaptation tends to be their first response. And here's an example, stunning example from Singapore of the Marina Barrage, where a dam has been built across the Singapore River, providing protection against floods and also a new source of fresh water. And of course, adaptation is important, but I like and am drawn to this warning from the IPCC in the 6th assessment report, which just made the point that every increment in temperature, every extra degree causes harm and shrinks the adaptation space. I like that picture of shrinking the adaptation space. And to give you an example, there's a cool roof project I'm involved in, which is exploring the use of cheap and effective treatment of roofs to lower indoor temperatures. Works very well, it seems, but operates best in quite a narrow temperature window. So if temperatures continue to rise, then interventions of this kind are going to be less effective. Now, Yuval Noah Harari, who many of you may know about, an extremely popular author, is not a doctor as far as I know, but he understands a central truth about prevention, which is that where it's available, primary prevention is generally far and away the most efficient response. And so I think that's a note for us to bear in mind when we're thinking about climate change. Now, I'm returning again to IPCC in terms of how we might, where we might aim, what might the target be. In the last assessment report, the notion of climate resilient development was made a bit of a theme, and I would say to city leaders, borrow this notion, because I think it is a magic one. Dr. Sellers talked about all three elements, I believe, of our response, adaptation, mitigation, and sustainable development that needs to be equitable. Well, how might this be put into practice? I'm going to outline for you briefly, because I don't have much time, three possible paths to urban resilience. The first is disaster preparedness. Now, there are many aspects to disaster preparedness, obviously, but a priority is ensuring that health systems are resilient. And this was demonstrated so vividly 7 years ago when Hurricane Maria ran into Puerto Rico. Most of the hurricane-related deaths occurred after the event as a consequence of infrastructure damage. And this, I think, underlines the point that we made in the 5th assessment report, but it still holds, of course, that in many ways the most effective measures in the near term to reduce vulnerability are simply to ensure that basic public health measures are available to all. We were reminded of this with COVID-19, already been referred to in the first talk. Even in a high-income country like New Zealand, COVID-19 reminded us of how fragile the health system can be when it's severely stressed and what serious outcomes there were as a consequence of those failings. And I draw your attention to the document on the right-hand side of the screen, an invaluable guide to monitoring, measuring, and improving health system resilience globally. It applies in all cities. It applies not just in urban areas, obviously, but I believe it has a particular relevance to cities. Now, pathway 2 to urban resilience, I suggested, was bringing nature into the city, more and better green space. there is a magic to it. We don't know quite how it works, but it achieves all those aims that I've written there. It's a way of cooling the city, it's a way of calming the population, and it's a source of carbon saving. I'm returning to Singapore now because, you know, the Marina Barrage was a sort of 3-in-1 intervention, as well as providing protection from floods. The way it was built provided new places for people to gather, a very important element of social infrastructure. And it brought nature into the city, as you can see this beautiful picture of one of the wetlands adjacent to the barrage. Another opportunity that arises frequently in cities is street trees. You might not realize this, but in many densely settled modern cities, more than a third of public green space is on the road verge. That's the space between the sidewalk and the road. And this provides a very important opportunity for providing shade and all the benefits that come with green space, as shown in a health impact assessment that was published last year. Looked at the consequences of increasing tree coverage to 30%, which is regarded as a bit of a standard, and many cities fall short of that at present. And the estimate was that this would reduce summer temperatures on average by 0.5 degree, more in southern cities than northern cities in the European sample, and prevent thousands of premature heat-related deaths a year. Now, I'm racing through these, but I hope that they're giving you a sense that, as Dr. Sellers said, we know a good deal already about how to respond, and the question is not so much what's required, but how to make it happen. And that's certainly true of my third pathway, which is sustainable transport. And it's illustrated here with a picture from Auckland, the city that I live in, New Zealand, at a time of severe flooding, something that's happening more commonly these days in our city as well as in others. And on this day, the only people who got to work were those on bicycles or pedestrians. Now, bikes are also, of course, low carbon, as you can see up there on the right, and they return a multitude of health benefits that I won't talk about here, but they certainly are well reported in the literature. The Auckland Transport Emissions Reduction Plan is a roadmap for the city to show how we could achieve a 40% cut in greenhouse gas emissions by 2035. And you can see a major part of that is going to be reducing emissions from the transport system. And here are some of the targets in that emissions reduction plan. I calculated just roughly what the consequences would be for tailpipe emissions and local air pollution as a consequence of halving vehicle kilometres travelled. And I estimate that the saving would be about 380 premature deaths a year. So that's more than threefold the number of road crash fatalities that occur in Auckland each year. Now, Auckland has a fine plan, but here is a city that has truly placed sustainable transport at the centre of its climate response. I'm talking about London. Sadiq Khan was recently elected for a third term as Mayor of London, and this is his autobiography, which was published just in the last few months. In it, he outlines how to use climate policy to win elections. And and it's an inspiring read. I would really recommend you have a look at it. It's easy to read. He writes very personally about what it's like to be mayor of an enormous city like London, the sorts of challenges that he's faced along the way as a consequence of his focus on environmental improvements and the successes that he's achieved. Now, Khan chose to use as his central policy low emission zones or ultra low emission zones, which are essentially low traffic areas, also called mini Hollands, rather similar to measures taken also in Paris and other French cities. And the picture here comes from Paris, obviously. But what's perhaps important for us is that it's not just the autobiography that we have to cite, but a whole program of research looking at the consequences of these interventions. And so I'd refer you to the work done looking at the London mini Hollands, which showed that these measures did indeed reduce pollution, slow speeds, lead to fewer injuries, more walking and perhaps more cycling, but certainly more walking and certainly less driving. Now, this is my last slide, and I just want to finish here by reminding you about what I see as the major points, and I hope that I can impress these on you. The first point, that cities are both a major source of climate change, but they're also where probably rapid climate action will occur first. They're both causes a problem and a significant opportunity. I'd suggest that we think about this notion of resilience as being one that involves limiting greenhouse emissions, reducing the impact of climate change, and improving well-being. It's the 3-in-1 that really matter. I think a resilient city is one that manages present climate risks. Maybe I haven't underlined that point sufficiently. That's certainly where we need to start, the flooding in Auckland, for example, and builds capacity for what lies ahead. And then the final point, quite an important one, I think, because city planners tend to focus on physical infrastructure for very obvious and natural reasons. But I think our job as health professionals is to remind them that it's equally vital to boost social capital, trust, engagement, confidence, the mental health of the population, and also to protect vital services, of which health, of course, is a very important one. So thank you for listening. Thank you for your patience. I'm sorry I'm not with you, and I value the opportunity to speak to you digitally. Good. Thank you.
Thank you very much to Professor Alistair Woodward for connecting with us. And as you presented, we cannot but emphasize the importance of securing more green spaces and cities and transitioning to sustainable transportation systems for effective disaster preparedness and response. So thank you again to him. And also, once more, thanks to our two keynote speakers. We will now take a moment to rearrange the stage before we move on with the World Health City Summit. So we will continue without a break. Once we're ready, we're going to continue with the World Health City Summit. But let me introduce the panel members that will be here with us. So our chair and panelists for this summit are going to be Kim In-mi, president of Ewha Women's University, who is going to chair this session. And our members are going to be Ines Barris, professor of health metric sciences at the University of Washington, and also Ruby Santos Matibak, the president of Bataan Peninsula State University, and Mei Fong Mai Sai, vice rector at the University of Health Sciences of Lao PDR. And we're also going to be joined by Gandhi Sulistianto, former advisory council to the President of Indonesia, and also Seydina Fall, faculty co-director for innovation and implementation at Johns Hopkins Institute of Planetary Health. And again, as we had before, Samuel Myers, founding director of the Planetary Health Alliance. So these will be the members who are going to join us for the World Health City Summit of the second World Health City Forum. So as we are preparing for the stage, please bear with us just a few more moments until we can begin. So after the World Health City Summit, I would like to remind you that we're also going to have a breakout session. So it would be great if you would participate throughout the afternoon today, as we have a diverse range of topics that we are going to discuss, very important, crucial discussion topics that we must address for the World Health City Summit. So we are going to begin in a few more moments. So I will kick off with the Health City Summit in just a moment. So please bear with us just a few more, let's say 1 or 2 minutes. Thank you. All right, ladies and gentlemen, thank you for waiting. Please take your seats. We are now going to begin with the World Health City Summit. So once again, I'd like to remind you to make use of the interpretation receivers. Channel 1 is for Korean and Channel 2 is for English. Now, if everyone is ready, we would like to proceed. So let's now continue with the discussion of the World Health City Summit under the theme of New Vision of Future Health City. Now, I would like to invite the chair of this session and panelists onto the stage. So why don't we greet them with a warm round of applause? Let's give them a big round of applause. So as I earlier introduced, the chairperson for this discussion will be In-mi Kim, or Kim In-mi, the president of Ewha Women's University. She will take the role as a chairperson to lead the discussion. So I am now going to hand the microphone over to President Kim In-mi, who is going to moderate this session. All right, I'm going to now toss it over to President In-mi Kim.
Good afternoon, ladies and gentlemen. Welcome to the World Health City Summit. My name is In-mi Kim, and I'm the president of Ewha Women's University. I have some students here from Ewha, so can you say hello? Hello, Ewha students. Hi. I'm honored to moderate today's session, A New Vision of Future Health. Today, the world is faced with two monumental challenges. One is to strengthen resilience in our cities and habitats against climate crises, pandemics, and various natural disasters, while striving to achieve sustainable development goals. Climate change in particular calls for a new vision and concrete actions for the transformation of smart health cities based on global urban participation and solidarity, as we just heard from our distinguished speakers. With these challenges and global participation in mind, we have gathered here world-renowned thought leaders who will give us some deep insights based on their evidence-based research and groundbreaking work from around the world, how our cities can become more resilient and sustainable in the face of climate crisis, pandemics, and other natural disasters. In the opening keynote speech, Professor Samuel Myers, who has been leading the global community in establishing the concept of planetary health, presented evidence and data showing that while development indicators related to humanity continue to improve in our lives, indicators concerning the Earth's natural life support systems are steadily and in recent times very rapidly deteriorating. He emphasized that dramatic changes in the way we live are needed to actively improve the situation. Professor Alison Woodward showed from some cities around the world how some changes or solutions have been made to improve the situation. You know, unfortunately, there are not that many examples from around the world how we are able to change, but he did show some evidence that incremental and in some ways some changes have been made and may have regressed, but changes were possible and showed some hope. Through the development and the implementation of global health cities, there is an opportunity to reduce our ecological footprint while optimizing both physical and mental well-being for humanity. Building on the suggestion that smart health cities are central to realizing planetary health and solutions for providing in the cities and climate change, I would like to first introduce our panelists before we begin our discussion. Our first panelist is Vice Rector Mei-Fong Mei-Shei from University of Health Sciences from Lao PDR. Professor Mei-Fong Mei-Shei graduated from University of Health Sciences from Lao PDR as a medical doctor and completed his PhD in tropical medicine from Mahidol University from Bangkok, Thailand. He is currently a visiting professor at University of Oxford in England and vice rector of University of Health Sciences. He holds many titles. It's very long, but it's very impressive. He's chairman of Research Promotion and Management Committee of the University of Health Sciences, chairman of the Lao Infectious Disease Society, president of the Lao National Ethics Committee for Health Research, and chairman of Lao One Health University Network. So a lot of the health-related issues at the university, but also at the government, he appears to be central. So welcome. So let's give him a round of applause. Let me introduce our second panelist, Ambassador Gandhi Sulistianto. He served on the former advisory council to the president of Indonesia. He's very familiar to Korea. He served as the Indonesian ambassador to the Republic of Korea. And before that, he worked in the private sector as the executive director of a group founded by the prominent Chinese-Indonesian figure, Sinar Mas. So let's welcome Ambassador Gandhi Sulistianto. Welcome. Our third panelist, Mr. Sedina Fall, is a faculty co-director for Innovation and Implementation from Johns Hopkins Institute of Planetary Health from the United States. He is a senior lecturer in finance at Johns Hopkins Carey Business School. He serves as the academic program director for the Real Estate and Infrastructure program. He is also a faculty co-director for Innovation and Implementation for the Johns Hopkins Institute for Planetary Health. He has a very interesting background and he explores topics at the intersection of sustainability and built environment, such as how to design and implement real estate and infrastructure policies that minimizes ecological footprint, improve public health, and leave room for reasonable return on investment. So he is able to realize how we can really do justice for planetary health. So please welcome Mr. Sedina Fall. And I think he needs no introduction, but I'll give him an introduction anyways. Professor Samuel Myers of Johns Hopkins Bloomberg School of Public Health. He's the founding director of Planetary Health Alliance. Professor Myers works at the Johns Hopkins Bloomberg School of Public Health. He's a leading expert in the field of environmental health, particularly in planetary health. He has conducted research in the intersection of climate change, environmental degradation, human health, and he focuses on how disease outbreaks is related to food insecurity and health inequalities. He systematically studies the relationship between climate change, public health, emphasizing the development of sustainable health policies and global responses. So he works with WHO, many other international organizations and NGOs. Let me reintroduce Professor Samuel Myers to our panel. Please welcome Professor Myers. So you can see we have a very distinguished group of panelists, so I have very tough questions to ask them. I have 8 questions, 2 questions each. I'm going to ask one question for each of the panelists, and they have different questions, so they can't, listen to other person's answer and then take a clue from that. So they have individualized questions. We'll do a 1 round, and if we have questions, we'll do a 2nd round. I'll go from Vice Rector May Say, and then we'll come back if we have time. So Vice Rector May Say, it appears that risks and opportunities coexist in cities depending on the geographical context. How should the future smart health cities be applied in the context of cities in Asia? Because most of the literature and most of the studies may have been focused on the West. And how do you see the literature or the policies be applied in the context of Asia and maybe Southeast Asia or Laos, PDR?
Yes, thank you. First of all, I think we have to know about the specific context of Asia. Given that Asia has the highest number of the population in the world, approximately 4.8 billion, with also very high diversity of the population, and also with health disparities. Number 2, there are many cities in Asia that are growing very fast and become what we call mega city, like Tokyo in Japan, Shanghai in China, Jakarta in Indonesia, or Mumbai in India, and etc. And these cities are different in many contexts. And the 3rd one is that Asia has been experiencing lots of natural disaster and also the climate vulnerabilities. For example, typhoon, earthquake, flood, even tsunami, and etc. Therefore, in order to make smart health city in Asia, we have to consider these issues. And the following are what I am thinking of, and I would like to propose some key priorities. First one, regarding the specific context health solution. As in Asia, we have many urban areas that are context specific. That's why in order to build the smart health city, we have to consider about the smart health innovation in this region as well. And this smart health innovation should consider many things. For example, in the area with flood-prone area, for example, we need to have the health facilities that are water resistant, for example. We need to have the very good monitor to monitor the level of the water with real-time data, for example. And of course, we need to develop the telemedicine or telehealth that can serve the population even at the emergency period, for example. That is the first one, the specific context health solution. The second one is that we need to incorporate the environmental data into the public health system. For example, in terms of the climate change, there's something like what we call the air pollution, especially the PM 2.5 that usually happen in Asia, and also the extreme heat and etc. That's why in this context, we need to develop the sensor, for example, to warn the people, to warn the population at risk. For example, the elderly people or the people with respiratory condition to know about this. So that is the second one. We need the environmental data to incorporate into public health system. And the third one is that when we develop the smart health technology device, we have to think about the affordability and also the accessibility to this device. And I think in this regard, AI-driven diagnostic can be applied. But of course, we have to think about the underserved population and vulnerable population who usually cannot get access to this facility. So the government will have to invest and also subsidize for those populations. So that is the third thing that I would like to propose. And the fourth one is that the resilient healthcare facility or infrastructure as well as the workforce. Because as I mentioned earlier, that in Asia we are experiencing a lot of natural disaster. So the health facility has to be resilient, can be adapted to be used in weather cold or hot temperature, for example. And also our healthcare workers should be resilient as well. Especially we have to think how to train them, adapt themselves. Even they can serve under the very critical condition like an emergency situation, like flooding or earthquake and etc. For example, that is the fourth one that I would like to propose. The fifth one is about participation or participatory health planning. This is very crucial. In order to make smart health city, we have to do the public engagement. We have to include the local community in this co-designing and co-creating the smart health city, because they are the one who know much better about the local situation, and they are the one who will stay and live over there. So we have to include them from the beginning. And the last issue that I would like to propose is about the privacy, confidentiality of the data, especially when we use the AI technology. This is a very important issue because people are scared or concerned about their personal medical information to be leaked, something like that. And also different countries in Asia have different data protection regulation or law. So we have to think about that as well. So these are something that I would like to propose in order to make a smart, healthy city in Asia. Thank you very much.
Thank you. Thank you. That was very comprehensive. All of these issues are related to very much what is happening in Southeast Asia, in particular in Lao PDR, but other countries in Southeast Asia. So very much to the point. Let me now ask His Excellency Ambassador Sulisianto. Now let me ask you the question about Indonesia, which we all know is comprised of many, many islands, faces a strong need to develop smart health cities based on the need to adapt to urban structures, to climate change, as well as I understand that you've had some discussions about relocating the capital. What are the key elements that the Indonesian government is focusing on in developing sustainable smart health cities?
Okay, thank you, moderators, Madam Kim. So let me begin to explain about my country, Indonesia. Indonesia, I think, is one of the ASEAN countries in the Southeast Asia. Indonesia have 280 million population. And Indonesia is the biggest archipelago countries in the world, with the width of about 3.2 million square kilometers. So it's a big country. From end to end, from west to east, it's about 5,000 kilometers. If you fly direct from east to west in Indonesia, it takes about 8 hours. So it's a big country. So among 280 million population, 60% of the population live in the island what we call Java. Probably some of you only recognize Bali Islands as one of the most popular islands in the world. But Bali is only part of Indonesia, very small islands. And I tell you, about 280 million live in 60% in Java. Therefore, Indonesia decided to move the capital city The capital city is located in Java, is now on progressing to move to the biggest island in my country called Kalimantan or Borneo. In the east of Borneo, that the new location of capital of Indonesia called Nusantara. So probably within 5 years, the all administration in Jakarta will move to the new city, capital city. It's already stated on the new President Prabowo. This project will be continued, and they supported the previous president policy to have a new capital city. This is about my country. And in economic point of view, Indonesia is number 16 among the G20 economy. And we aiming to be a number 5 in 2045. It is quite aggressive and optimist development country. We will be a number 5 in the world in 2045. And this year, with the new administration, President Prabowo targeted 8% development of GDP. It is quite aggressive. So developing smart health cities is indeed a priority of our country. For any countries, but especially crucial for the nation as diverse and expansive as Indonesia. Our focus is establishing smart health city that leverage technology and sustainability. There are 3 main issues or 3 main factors that probably we are focusing on. Number 1 is international collaborations. Number 2, technology advancements. And number 3 is strengthen healthcare infrastructure. This is 3 things that we are focusing on. So the first, international collaboration status, actually Indonesia just released a new omnibus law, especially on health, in 2023. It's laying the necessary groundwork for smart health cities by encouraging international collaboration and technology exchange in the healthcare sectors. The law encourages foreign investment and simplifies the process of foreign trained healthcare professionals to work in Indonesia, facilitating essential knowledge sharing and skill transfers. Just for your information, that our medical workers, or especially medical doctors, per year we have only 2,500 people. It is really not enough for our big countries like Indonesia. So although so many demonstrations and against the regulation, especially from the Association of Medical Doctors in my country, but government forced to have this omnibus law in order to help and accelerate the medical healthcare industry develop in my country. So about the international collaboration is very key factors in order to make this all successful. This collaboration strengthens the Indonesian healthcare system and prepares our cities to offer world-class health service in line with the best practice and smart health city worldwide. And then we move to the second priorities is expanding digital health infrastructures. I think we learn from our sad experience during the pandemics, COVID-19. We are suffering, actually is together with all over the world. We suffer a lot of things in order to improve access and efficiency and also data-driven action at the time. So, looking ahead, Indonesia recognized the need of further expand digital adoption to enable a citizen to manage their health in real time, including access to telemedicine making healthcare more accessible and convenient. Telemedicine services, in particular, expand access to care for remote areas. Because, as you may aware, our 70% or almost 80% areas is actually a remote area. It's only a little bit, only a little percentage is urban area or big city. The rest is remote area. And reducing the need of in a person visit, enabling virtual consultation. In Indonesia, we have the national application system, what we call One Health, which everyone can be enter on this application and to get access directly to the Ministry of Health in order to consult what they need. Then the third one, we are strengthening health and wellness infrastructure. Building resilient healthcare system takes more than just advanced technology. It needs strong, reliable infrastructures. That's why Indonesia is investing in a local health facilities, expanding medical supply chains, and rolling out continuous training program for healthcare workers, as I mentioned you earlier. All of which is done to ensure quality care is accessible nationwide. A big part of this effort is upgrading facilities and establishing new centers, especially underserved area, to bring essential service closer to home. You may also aware, in my country, we have what we call the public health care centers. It's totally about 10,000 centers, especially in the rural areas. Of course, this is not enough for us because we are 280 million people and 60% or even 70% is live in the rural area. We need more and more public health service centers. So, in that case, of course, we are trying to make digitalization as soon as possible in order to reach that problem disappear. And then at the same time, continuous training program for the healthcare workers are helping professionals keep up with the new technology, enhance patient care, and respond effectively in crisis. Together, these steps align with the Omnibus Law vision of stronger, more reliable healthcare. This is our main focus on this. What's your question,
Thank you very much. I think with Indonesia's archipelago, with the many islands, and as Vice Rector mentioned, climate change has really affected Southeast Asia with the rising ocean temperature. The natural disasters have really hit this area heavily. So the challenges that the two countries face are quite alarming. The readiness of your countries are quite, what you're trying to do are quite amazing, and you've done a lot, but even as we speak, I still worry with the next pandemic coming, because all the scientists and medical epidemiologists are telling us the next pandemic is coming, and are we really ready and prepared? And that's what concerns me. But let me now turn to Mr. Fong. Are we ready? Resilience and sustainability, which are the principles of smart cities, be applied in an integrated urban design for smart health cities. So give us some insight of how the kind of work that you're doing, where you're bringing in the knowledge of infrastructure, the hardware, to the discussion of smart health cities, and maybe give us some insight of how we can actually implement it in Southeast Asia.
Great. Well, thank you, first of all, for having me. As far as insights, we're focused on developing a concept around planetary health cities. I think the gist of what we're looking to do is, smart cities, we can define them as using technologies such as Internet of Things, for example, technologies such as information communication technologies, but to achieve what? To achieve improved efficiency of quality of services, improved quality of life, but we're increasingly focused on planetary health, the impact on of the built environment on the planet and the impact of the planet on the built environment. So ultimately, we want to be able to obviously have quality of services that are more efficient, open data platforms, a lot of what the co-panelists mentioned, but we also want to focus on quality of life, planetary health. How can technology help us achieve that? It's interesting that when you look at indices that rank the smartest of the cities, there are a lot of indices there, you see that there's not necessarily a correlation between being a very smart city and how you handle the COVID-19 pandemic. So there's a lot of work that needs to be done. Smart cities have a couple of different pillars that I think could be good levers that we can improve upon the work that's been done so far. So, what I would mention is first the infrastructure governance, right? This is something that's increasingly important. That means the decision making, the policy making. One insight I can give you is all of these material passports that are now being mandatory in a lot of cities. We need to know the type of materials that we use in construction and also in building infrastructure. Another important pillar of smart cities is the physical infrastructure. Right, so we've got a bevy of certifications, standards for the built environment. In the U.S. we have a LEED, well-built, fit well. We have a lot of different standards that are self-reporting standards that buildings, if they're designed a certain way, get a certificate. But as far as an improvement, something that's more, I would say that would work more from a planetary health city standpoint, is to use life cycle analysis. In a lot of the work that we do, we use life cycle analysis at the building level to try to come up with a carbon budget for a project. So we can think of it as some sort of allocation strategy. Right? We can quantify, let's say, at a global level, by how much are we transgressing the planetary boundaries, whether it's by millions of parts. That could be translated into a budget, an emissions budget at a country level. Then that could be allocated from a country level to an industry level, and from an industry level to a project level. And life cycle analysis is very effective at coming up with a budget, a carbon budget for a large project, a large infrastructure project. So that's one lever that we're working on. Then, you've got the social infrastructure. We talked a lot about social infrastructure. Smart cities as a concept has done a very good job at making us more aware of the connectivity that we have, the quality of life type of aspects. But increasingly, we want to focus on things like, let's say waterfront properties. A lot of waterfront properties currently, could be deemed to be stranded assets that you can't really do anything with them. They're certainly not habitable in a lot of a lot of cities. And what we increasingly want to do is use urban design to use that space so that people can be closer to nature, right? Design parks, design walkways, so that we could use that space to increase mental health was mentioned in a couple of sessions earlier today. And finally, we have the economic infrastructure, the whole discussion about GDP versus other measures, we need to be able to measure, the right metrics. So this involves a lot of discussion about donut economics. So donut economics is, I would say, a foundation of a lot of what we do, trying to develop the principles of planetary health cities. I would also, mention a little bit of the work that we're doing in what is a planetary health business, right? What is a planetary health business? What are some of the principles that a planetary health business should have? Now, globally, we have big corporations. We've had many attempts at changing the nature of partnerships, of business, joint ventures. But what we're looking to do is really focus on coming up with businesses that are regenerative. That's really the goal. Regenerative and redistributive is something that is very important. So, I would just say we need to move again beyond smart cities. Whether it's a question of coming up with another name or not is not really what's important. What's important is that we've achieved a lot with open data platforms as far as quality of services for cities, and I think a lot of urban citizens in cities have been very grateful to have the technology, but we need to do more in terms of quality of life and our footprint, our ecological footprint, and there's a lot of technologies. Again, we can keep discussing, but life cycle analysis is one of them. As I said, the materials passport is something that could be implemented. So using those 4 levers, whether it's governance infrastructure, physical infrastructure, whether it's social infrastructure, whether it's economic infrastructure, the technology could really help. But the end goal, again, is to do things that are both good for the planet and help us thrive in a regenerative and redistributive way.
Mr. Fei, I'm going to ask you, Mr. Fall, I'm going to ask you a mini follow-up. In your educational background, you also have an MBA, and you're a CFA, Chartered Financial Analyst. So you're not just saying your work in the planetary health system, this is not just for the good of humanity, but this has to make business sense, right? You talk about, what is it? What's the word?
Yeah, I mean, perhaps I can...
reasonable return on investment.
Right,
Yeah,
yes.
I like to spend money for the good of and I don't think about return on investment, but you obviously think about return on investment. So convince those people, maybe not in this audience, but other audiences who may be thinking about, is this worth my buck? So tell us, convince those people who might not be convinced that this is not good on their investment.
Right, so thank you for the question. It's a great question. A lot of the work that we're doing with the Planetary Health Institute, in addition to developing principles for planetary health cities, is that we work with the asset management industry, folks that manage pension funds, endowments, whether it's sovereign pensions or family offices. And to your point, this is exactly what we're looking to develop, is ways to measure our natural capital. Right? It doesn't matter which business you're in, whether it's in manufacturing or you're going to use some of these free, natural capital ecosystem type services that nature gives us, quote unquote, for free, that we've been damaging increasingly. So a lot of the work that we're doing is quantifying that and educating asset managers so that when they're making classic decisions about capital budgeting, what's my internal rate of return, all of those finance jargon terms, we want them to embed in their decision-making these ecosystem services that they get, the pollination, the fresh water from nature, so that they can see the risk of damaging that. And we're working on a couple of case studies directly aimed at that.
Great, thank you. Now, Professor Myers, in your presentation, you gave us a very clear picture of if we don't do anything, the risks of not doing anything about the ecological footprint and whatnot around the world. And then you told us about the solutions about the smart health cities, the planetary health, that we must think about the planetary health. And at the end, you appealed to us that we should participate as networks of cities, that we should all sign up. So tell us about the value of networks of cities as a way to catalyze the adoption of new planetary health practices. Why is it so important that we participate as networks?
Yeah, thank you for the question. I just want to reflect for just a minute before answering that question, because I'm struck that we're having this conversation, and that 15 years ago, we sort of had the privilege of separating the conversation about how we keep our populations in cities healthy as one conversation, and how we protect the global environment as quite a separate conversation. And that now we've reached a moment where to ignore what's happening to the global environment and focus on all the important things that we have to do to protect our health, like vaccines and prenatal care and health services, that if we focus solely on those things, we're essentially rearranging deck chairs on the Titanic, that the scale at which our systems are beginning to break down has forced us to shift the conversation. And it's why what Sedina is saying about businesses, they can't ignore the fact that we're approaching these thresholds of destabilization, any longer. And it's why it's a more complex conversation of how do we protect our health while protecting and regenerating the life support systems that we depend on. But your question was about networks of cities, and I'm no expert in this, but I'm just very struck that we have a lot of global city networks and regional city networks. We have the C40 cities that's focused on climate change in cities. We have ICLE that focuses on sustainability. We have the Donut Cities initiatives. We have regional initiatives, WHO initiatives. And it makes a lot of sense because in the context of federal governments that, as my own country will show, are very unpredictable, and the fact that cities tend to be very practically focused on problem solving, cities are a wonderful unit for making change. And yet, they're relatively small compared to the planet. And so that change is only particularly relevant when you're talking about these planetary processes if it happens at scale and it happens across thousands of cities. And so how do we ensure that? The other thing that's striking is that the cities are all dealing with similar kinds of questions. What Sedina was talking about what are our building technologies and how do we think about active transport systems and public transport, and how do we think about energy efficiency in buildings and water recovery and sewage treatment, and all. These are not dramatically different challenges in different cities. So how do we generate networks to connect our cities so that they can really begin to learn effectively from each other? And I'm just curious about the fact that we have so many of these networks, and I'm wondering if there isn't a need as a community to begin to rationalize these networks and think about, with respect to this topic of smart healthy or planetary health cities, can we tap into these networks and bring them together in some way so that we're effectively learning from each other and sharing each other's case studies so that we can make progress in a much more efficient and effective way?
Thank you very much, Professor Myers. I think we had a earlier question that I was going to ask, but in the interest of time, I asked you the second question first. I think we're supposed to end now, so maybe I'll try to wrap up. I've been involved with the United Nations working on Sustainable Development Goals, and I was in the independent group of scientists who worked on the 2019 Global Sustainable Development Report. And a lot of the graphs that you showed, the dramatic rise in everything in the last 50 years is what we looked at. We knew that, but just to see everything in front of you like that was so alarming, and that we had to take action. Between 2019 and when the second report came out on 2023 with the pandemic, everything changed and everything just intensified so much, and the cost to our health, to the planetary health, was just exponentially much higher. But the virtue of the World Health City, the planetary health, breaking it down to cities, I think makes it more tangible, makes it something that we can all work with, and the networks of cities makes it something that we can look to learn from each other, benchmark, and having friends that we can look at to hold hands together, to help each other when in need. And I think this is a way that when you have these insurmountable problems, when you can't see the way out, this is a way to have friendship and partnerships to see the way out. So although we didn't have enough time, I just want to thank our distinguished panelists who helped us localize the problems, but also help see the way out of this problem. And I always want to end with a positive note, so thank you very much. So hopefully we will be able to get out of this together. So thank you very much. Thank you all for your patience. Thank you.
Thank you very much again for that discussion. Let's give a resounding applause to our panelists and chair for that lively discussion. And this will conclude the opening ceremony of the forum. We kindly ask for your active participation in the various upcoming sessions that will take place starting at 3:30 p.m. So that will be in 10 minutes. And the speakers are requested to move to your session at the Grand Ballroom or Conference Rooms 1-1 to 1-4 for the smooth proceedings of the preparations of the sessions. And if you need any assistance, please visit the speakers room, room 102 on the first floor, or request support from the forum staff and volunteers from the University of Utah. Now, additionally, the forum is focused on identifying key aspects that smart health cities need to concentrate on for the transition to resilient and sustainable communities. We are developing a smart health city pledge based on this. So please check the QR code that we are going to have on the screen now here. So please check this and participate actively in this important survey. And I will see you again at 3:30 p.m. for the Planetary Health Alliance session. So I hope to see lots of you at the session as well. Thank you very much. welcome to day one of the forum's breakout session. We will now begin the session on planetary health global community. The session is led by Professor Samuel Myers from Johns Hopkins University, who gave today's keynote speech earlier in the day, along with community members from 8 countries participating in the Planetary Health Alliance global movement. The PHA is a consortium involving over 450 universities, NGOs, research institutions, and government agencies from more than 75 countries, dedicated to understanding and addressing global environmental changes and their health impacts. Through this session, we hope you will gain insights into the efforts of PHA global community members in promoting harmonious changes for human and environmental health through the Planetary Health Roadmap and Action Plan, as well as their future directions. So let's start the session with opening remarks from Professor Samuel Myers, who delivered today's keynote speech. So please join me in welcoming him once more to the stage with a big round of applause.
All right, well, thank you. I really don't want to speak very much. I've spoken way too much already. This is a really important and exciting conversation that we're about to have. We had a conversation earlier about networks of cities and another kind of networking and collaborating that we feel is very, very valuable and important at the Planetary Health Alliance is our regional networks. And so how do we bring together academia, civil society, government, and the private sector to work together on planetary health challenges as they manifest in particular regions? And we believe that there's a great deal that we can learn from each other within a region and coming together to share stories and to have our convenings. And so this is just the sort of beginning of a conversation to understand what's happening across East Asia and the experiences of many of you in the places where you work, with the sort of overarching frame of the global action plan and roadmap that our colleagues in Malaysia were so instrumental in developing and putting forward. And so mostly I just want to hear your stories and listen to what you have to say and get out of the way. So with that, I look forward to the rest of this conversation. Thank you.
Thank you very much, Professor Myers. We very much look forward to the upcoming lectures, as you just mentioned. So on that note, let me introduce our first speaker, who is Dr. Jamila Mahmood from the Sunway Center for Planetary Health in Malaysia. Dr. Jamila Mahmood, a professor at Sunway University, serves as the executive director of the Sunway Center for Planetary Health and has made significant contributions to the development of the Planetary Health Alliance's roadmap and action plan. So please join me in welcoming Dr. Jamila Mahmood with a big round of applause.
Thank you very much for your very kind introduction and also Sam's opening. So what I will try to do today is, oops, this is the last slide. Let me try again. Can we go back to the first slide, please? You cued it to the wrong slide. Sorry about that. No? Here you go. Thank you very much. So what I'd like to do today is to share with you a country perspective of how we have taken planetary health forward, what are the achievements so far and where the challenges are, and also share a little bit about the planetary health roadmap and action plan that was mentioned by Sam. For Malaysia, we always thought that we were sheltered from climate change and disasters, but unfortunately, this is no longer the case. We are seeing increasing risks in our country, particularly from flooding and heat waves, and the cost to the Malaysian government in terms of economic impact is extremely high. We know globally the costs are around $125 trillion per year, and that the increasing health costs are also phenomenal. So even in a country like Malaysia, which is a high middle-income country, we are already feeling the significant costs, and therefore the cost of inaction is too high. Over the past 1.5 years or so, led by the Academy of Science in Malaysia under the Ministry of Science and Technology and Innovation, a National Planetary Health Action Plan has been developed. And I'm very happy to announce that on the 4th of November, this plan was presented to the Prime Minister as the chair of the National Science Council, and it was approved. But it was also approved with a provision of budgetary allocations, but also inclusion of planetary health into our next 5-year development plans called the 13th Malaysia Plan. This has arisen from a robust process of consultation with many diverse groups, with 6 pillars across the different ranges of the importance of planetary health. And in a nutshell, some of the areas that we have agreed upon is that we need to make 5 key shifts to achieve a planetary health action plan. And these include strengthening governance, especially on natural resource management, building a society that is rooted in values, in health and well-being, also creating a landscape where innovation can thrive, where businesses can also thrive sustainably. Effective communication and cultural transformation will be key. And last but not least, ensuring there is sustainable financing to see this through. So how will this plan then support sustainable development goals? It will not be an additional layer, rather the Planetary Health Action Plan will actually support and develop, the framework developed will actually accelerate sustainable development goal attainment by breaking some of the silos and allowing some systemic shifts and widespread collaboration and interdisciplinary approaches. Of course, there will be challenges. In anything that is new, there has to be policy and governance alignment. There could be weak understanding of interconnections because generally ministries and even the SDGs themselves are quite siloed. There are expert shortages in planetary health communications. Generally, science is often communicated in a way that many of the public don't understand, and planetary health itself has its own challenges. There is a disconnect between business and planetary health impact, and even though there is ESG, or environment, social governance frameworks, many a time if you study them carefully, there is a disconnect with health. And last but not least, we need resources, and there will always be budgetary constraints. I'm based at a university, and just to demonstrate how at a university level it is possible to have some alignment to planetary health. At Sunway University, which is a private, non-profit, young university, you will see that there are some subject matters. If you look at the planetary health educational sort of framework of concentric circles, ultimately, it is about interventions, it's about projects, it's about power relations, it's about equity, prosperity, and health, and of course the wider environment and biodiversity and protection of our planetary boundaries. So to do that, what we have committed to is looking at entrepreneurial mindset and skills, because innovation will be required, looking at community service for planetary health, so a mandatory module in planetary health that is followed by community service, so taking solutions to action, and also looking at governance through an integrity and anti-corruption framework. All these are mandatory for every undergraduate in the university to pass before they can graduate from the university. The Planetary Health and Community Service, we call it an MPU, is a general studies module for 7 weeks. It will mainstream planetary health education for undergraduate students. It is a collaborative delivery, which means that it is irrespective of what faculty you are in, you will have to take this, and it will advocate positive change at the community level, because ultimately the students go down to the community and practice what they learned. So hopefully this will be something that will change the new leaders that will come out of the university, who will understand there is impact on the decisions they make as leaders in the future. Of course, there will be challenges if you're going to embark on this. It's a new subject, so the manpower needs will be high. There has to be coordination. We have to make sure the students are engaged and excited about it, and then find the money for students also to do some projects on their own. In April this year, we organized the 6th Planetary Health Annual Meeting, and we also had what we call a Planetary Health Summit, because we brought in a very wide range of stakeholders, from private sector to journalists to faith leaders, and so on and so forth. And we have developed this planetary health roadmap. As you can see, there are some elements to this roadmap measuring planetary health. If we're talking about planetary health, how do we measure it? Secondly, how do we communicate it? Third is, how do we educate to achieve the great transition? What kind of revolutions in education will be required? We need to build holistic governance at all levels, and we also have to make sure that businesses also balance their actions in alignment with planetary health. And finally, how do we mainstream planetary health so that we will all achieve a healthier planet and healthier human beings as well? The Planetary Health Roadmap also adopted a Kuala Lumpur call to action, and there are 6 working groups that are going on right now based on those 6 elements that I described earlier. And they're meeting regularly. There's stakeholder engagements, there's public awareness, and behavioral change that we need to deal with, because planetary health is still fairly new and nascent to many communities. And then the other thing, of course, what are the data that we require? And half the time in many of the developing countries, it's quite difficult to get data. So for measuring planetary health, we have to make sure we have open source, reliable data that is actually available for all, if not most countries. So it was mentioned earlier on donut economics. This is an area of work that we have embarked on at the Sunway Center for Planetary Health, where we are piloting donut economics in one of the cities in Malaysia. Donut economics basically is regenerative economics, looking at making sure we find that safe space for humanity, which does not transgress the ecological ceiling or the planetary boundaries, but also allows communities to develop socially. In other words, the Sustainable Development Goals are achieved. Ipoh is the name of the city in Perak. It's the first city in Asia to embark on donut economics. And what it has also done is adopted the entire donut economic framework as a monitoring tool for the development of the state. I'm very pleased to share that at the recent World Urban Forum, Ipoh was recognized by UN Habitat for the Scroll of Honor. What it does is that it will portray a city in action. And there are some key demonstrator projects, basically covering the 3 themes with 7 different projects. And they include ecotourism, waste and water management, energy, and transportation. Some of the challenges of implementing something like donut economics at the state level or the city level is around fragmented data, trying to get the data together, getting the political commitment and securing multi-stakeholder buy-in. This is something that you need to work on very hard from the start. And you need to change mindsets from short-term growth to long-term vision. And I think the operationalizing donut economics in local governance will require a real stakeholder engagement, ensuring municipality and state level coordination is also very clear. The other area of work we are embarking on is on decarbonizing healthcare. You would have probably heard that if the healthcare industry globally was a country, it would be the 5th largest emitter in the world. And what we have done is build a partnership with our Ministry of Health, where we are training health officials or officials of the Ministry of Health on how to decarbonize. And we have started to train, I think, 150 workers. This will continue over the next few years. And hopefully with this, we will have a much more green health sector. But there's a real commitment from the minister himself and the ministry to be net zero by 2030. Some of the challenges, of course, is lack of expertise and training. So we need to build this in partnership with others who are much more knowledgeable than us. We've had a wonderful partnership with Healthcare Without Harm, to get our staff certified as well. And what we'd like to do is really to transfer that, building training of trainers for the Ministry of Health. Waste management issues are really some of the biggest challenges in the health sector, and also looking at data and monitoring limitations. So you do require quite accurate data on energy and on emissions, consumption, and waste production as well. So I've shared with you a couple of the programs and the achievements in Malaysia, also been very frank and open to share what the challenges are, but I really look forward to Asia leading the way, showing that it can be done, and that I think the more we learn from each other and collaborate and share our experiences, I think we can put planetary health in the right trajectory in this region. Thank you very much.
Thank you very much to Dr. Mahmood for her presentation, which very well laid out the PHA activities in Malaysia, the achievements and challenges. And we're also going to invite her back as our final speaker shortly. Now, the next lecture will be conducted by Professor Chiho Watanabe from Nagasaki University, who is leading the PHA community in Japan. We are very much looking forward to hearing about the active initiatives of the Japanese PHA in the East Asia region. Now, Professor Chiho Watanabe will be presenting online in real time, so let's welcome him with a big round of applause. Hello, Mr. Watanabe. Can you hear me well?
Yeah, I can hear you. Can you hear me?
Great, you may begin.
Okay, thank you. Hello, everyone. And I'm speaking from a very tiny hotel room, and I cannot imagine how the venue is in the road. But anyway, today my role is to introduce what is going on in Japan. And I prepared 24 slides. I need to finish it in 10 minutes, so it's a little bit very hard task. And okay, just start with the first one. Okay, I'll briefly talking about how the Planetary Health Alliance Japanese have started. And so 3 years back, we started the co-translation of the São Paulo Declaration, which has issued by the Planetary Health Alliance Global. And we translate it into Japanese and open to public. Then we start a collaboration with Health and Global Policy Institute, which is one of the NPO in Japan. And they just started that year, the Planetary Health Project. And the next year, 2022, same year, and we started canvas with each other through the Zoom meetings to shape a group. And sorry. Okay. And I think that at the time, the hub started the activity. And in the end of the 2022, we contact with Planetary Health Alliance Secretariat. And early next year, we had the first meeting with them, headquarters, and we started the Japanese Hub Alliance activity, Japanese Hub activity in an official way. And this year, in June, we launched the homepage and started the mailing list. And I think that more or less the 12 steering committee members and about 80 mailing list members are acting here. And these are just a sample of what we have done in the past. And we have launched many seminars, domestic as well as international. And actually, last week, we invite Samuel Myers to Hiroshima and one of the big cities in Japan and discuss about how to proceed with the planetary health thinking. And as Dr. Jamil already announced, we Planetary Health Alliance meeting conducted in the Kuala Lumpur, and then we proposed a couple of the sessions, and so we have been very active in that annual meeting also. As I already introduced, we opened the homepage, and you can just easily Google that, and we have also the English page. And last September, we started the monthly meeting of the cafe and bar so-called. And so then everyone interested in the planetary health can gather together and chat about new topics. Unfortunately, this is conducted in Japan so far, but I think that we are planning to do it also in English. Then what's going on in academia, and Nagasaki University, where I'm working for, is the first university in which introduced the idea of the planetary health among the many universities in Japan. And in Nagasaki University, we do some activities in the education and advocacy and the research opportunities and the student activities and the external connections. And so a lot of the various ways that we can pursue the planetary health. And among them, in the education, we opened a mandatory lecture course for all newcomers, about 1,700 newcomers. And this is very rare, I think, among the world universities. And also then, among the student activities, Planetary Health Report Card is one of the international activities conducted by the international students, not only in Japan, mainly in America and Europe, but I think that maybe a couple of the Asian universities are also joined, and I would like to invite many of you to join this activity. And this is just the idea of the planetary health initiative in our university. I just skip it. So currently we have 5 universities and the National Institute pursuing the planetary health with some organization and initiatives with the name of the planetary health. And other than that, we have some other universities which offering the courses along the idea of the planetary health. So many academic associations show the interest in the planetary health. So these are just an example of some academic associations in Japan, and which held some symposium or forum for the planetary health. So I think number of the associations which interest in the planetary health is now increasing in Japan. It's mainly in the health science area, but also the environmental science area. Then we have some governmental document which mentioned the planetary health, particularly in the top level of the governmental documents. Now, for example, Ministry of Environment issued the 6th Basic Act on the Environment, and which mentioned the planetary health in many times. And I think that basic policy of the Ministry of Environment is all the policy for the environment finally aiming at the achievement of the human well-being. That's a very unique thinking. And from the Cabinet Office, they issue the SDGs implementation guiding principles, and which also mentioned the planetary health as to guide the practice of the SDGs in the right way. And also the Ministry of Health in Japan declared the participation to the ATTACH, which is concerning the relationship between the climate change and health. So I think the couple of the ministries in Japan started to pursue the idea of the planetary health. Other important players include many NPOs, and I just mentioned two of them, and the Health and Global Policy Institute, which is running the planetary health project since 3 years. And they have a strong pipe with the medical and the healthcare community as well as the policymakers. So we can, by collaborating with them, we can just actually realize what we product as a scientific product to be practice in the real world, real society. And also we have a group of the physicians, and they name themselves the green doctors, and they have an active network of the health-related personnel. Also, some business organizations have an interest in the planetary health, and one of them is a bio-community Kansai. Kansai is the name of the place, but they will have an international conference, a big conference, Bioeconomy Hub Japan in next April. And also, I didn't mention each name, but a significant number of the companies started to show their interest in the planetary health. Also, some media shows the interest, and one of the big paper, Asahi newspaper, held a web conference, and which also emphasized the planetary health. Here, I have some example of the research, and this is big research conducted by the Hiroshima University, and I think the delegate should be there in your venue, and they are pursuing the idea of the planetary health aging. I think it is a very interesting overlap between the human and the social system and natural system. These are members of this project, and I also would like to mention this one, and this is a community or area-based project in the rural area in West Japan, and this is the collaboration among the medical and the food and the agricultural field, and they are very active. And I think that even the number of these projects is not so great, but this community-based project is very active. And finally, as Jamila already mentioned, I think that maybe the Eastern thoughts can be one of the alternative views about the world. And I think that together with the many Asian countries, we can promote this kind of idea, and which has a similarity to the thinking of the so-called indigenous groups. Okay, that's what's going on in Japan. I stopped here, and thank you for listening.
Thank you very much to Professor Chiho Watanabe from Nagasaki University for introducing us to how to achieve planetary health in Japan. And next we will invite Dr. Kim Do-ko to share some examples from Korea. Professor Kim Do-ko has served as the director of the Sadang Clinic, the first director of Wonjin Green Hospital, PM at the World Health Organization's European Center for Environmental Health, head of the Environmental Health Team at the WHO Western Pacific Regional Office, and director of the WHO Department of Science and Standards. And he is also very familiar to us as he has been featured in various well-known broadcasts. So he is already on the stage. Why don't we give him a big round of applause?
Thank you very much for nice introduction. It's my great pleasure to share some stories about kind of a budding planetary health movement in the Republic of Korea. My talk will be rather a bit informal and a bit short because there's no real much substance so far. But I hope this will be kind of a very good kind of a stimulation for our growth. And I'm glad that for the first time we can share our story with our international friends. Next slide, please. Oh, here. This one. Yeah. First, from outside of the country, we can see many research articles published in, say, the Lancet Planetary Health, sometimes even Nature, Science, many leading medical journals or health public health journals that many Korean authors are publishing excellent papers. Sometimes it's about air pollution or urban planning, urban development, climate change impact, and so on. So they are all we can consider in the area of planetary health. So we have a kind of an impression that, in Korea, there should be very rich research, study, education on climate change and health, and also planetary health. For example, the latest publication from the Lancet Planetary Health, also Lancet Psychiatry, talking about experience of Korean cities during heat waves and how those with disability suffered more. Excellent paper, a very great contribution to world science in the area of climate change or planetary health. So I was interested how Korean society is aware of this planetary health approach. As we understand, initiated from the first Lancet manifesto and Rockefeller Lancet Commission studies report and Planetary Health Alliance and so on. And then Sao Paulo and Kuala Lumpur, all the development. And now we have a roadmap and action plan. First, I realized we have a problem of translation. I noted from Dr. Watanabe's presentation that in Japan, they just adopted the original word, planetary health, planetary health, planetary health, just the sound as is, rather than trying to adopt into Japanese language. That could be an option in Korea as well. Actually, because there is no formal established education or educational society or professional group on this field yet, we have to choose. So I found there are 4 translations so far. By the way, adopting English, just sound by sound, could be a bit alienating in many majority of Korean population, unlike Japan. In Japan, I think planetary is quite easy to understand for most Japanese people. Maybe that's why they are just simply adopted. Health also. But in Korea, we don't have that kind of public understanding of English words. So first was 지구 보건. That's kind of a public earth health. But health in this word means a bit further, not only health in general, it is a protection or policy of protecting health, promoting health. It's a bit further, a bit of a medicalization in a way. They just adopted that word from public health, global health, international health into planetary health. Actually, that was the easiest understanding. Okay, in front of this public health, you put planetary. So it sounds like a planetary public health. Anyway, that's so far the most popular interpretation, and it's adopted in the Wikipedia. And Wikipedia, like 2 pages, not long, unlike English version, and provide basic concept of planetary health and history, scope, quite good summary. I was delighted to see that Korean Wikipedia already has a chapter, a section, but it adopted that kind of language, 지구보건. Second is same, Earth health, planetary health. So planetary health can be translated into Earth health because in Korean language, there's no direct one-to-one translation of planet or planetary like we use in English. So it comes to Earth, from planet to Earth. And okay, open to health promotion and broad concept of health that we want to adopt. So that second language is Earth health, not Earth public health, Earth public health. Third one, this is also a language issue. Planet is used in astrology to denote Venus, Mars, Earth. So they adopted language from astrology and use same. So in English, the same, planetary health, but in Korean, when they adopted this more kind of a natural science language, it becomes a different meaning. Only not limited to Earth. Are we worrying about health in Venus or Mars? No. So it's not right. But still, some of the first writers who introduced planetary health into Korean group, you adopted this because I think at the time there was only possible translation at the beginning until we understand better. Finally, also, yes, instead of public health, use health. So, or different combinations, whether we choose to focus on Earth or general planet, or whether we focus on policy and the more established public health or broad health, ecosystem health, for example, which is not handled by traditional health. So we still have some barrier to communicate better. But that's why I think next story may be interesting. There was some group of people who considered these issues. So this is a few samples actually from Googling. And the first one in 2021, Professor An Byung-ok, who has been a leading professor for many decades in the area of environmental movement, first introduced this concept. Very good summary of what's going on. Basically, kind of a introduction about the Lancet article into very short Korean paper. Okay. He adopted this more astrological wording at the time, and then these days, 2022 or this year and so on, it is used as a kind of a lifestyle approach in relation to diet, even sometimes a commercial interest. So if we are too slow, this word, planetary health, can mean quite different thing in Korean society. That's why we feel a bit urgency here, because some food industry found this, the planetary diet paper interesting, and they used for the marketing purpose, and then suddenly they use mixed earth health or plant health. And among the vegan community also it is now used. Okay, so now this movement group, personally I have been in WHO from 2003, and then I started as an environmental health officer in Europe, and then I have seen the growth of the body of science in climate change and health from Europe and around the world. Fortunately, I was assigned to Fiji in 2013, just before Paris Agreement and so on. I was there for 4 years, and then visiting almost all Pacific Island countries to help them, first, environmental health issue, second, disaster response because of cyclones and flooding and so on as well. I am completely converted into just a environmental health person to climate change advocate. I'm climate action advocate, and now a planetary health advocate. So, like me, there are many WHO staff who have been working in many vulnerable countries and learning something, realizing something. We should also, public health workers or global health workers should also respond differently, different scale, different speed when we have this kind of a crisis, global health crisis, which is climate change. So there was growing interest, particularly after Paris Agreement. And also Lancet manifesto and Commission report. Then there were 2 books that I have shown before, Dr. Sam Myers and Howard Fromkin's book, and also Andy Haynes and Howard Fromkin's book. Those 2 books were published in 2020 and 21. And at the time I was working in Geneva in the science division, and we had a kind of a informal group of Korean staff sharing their views and career plan or all the personal, professional things. And they all agreed we have to study, we have to prepare ourselves for the coming trend, coming wave, coming challenges. And somehow we all agreed the current way of response does not really work. Sometimes many WHO staff, not only WHO staff, many expats, many development workers, international health or other international agency staff in the countries often feel that way, kind of a hopelessness and helplessness. And when these 2 books came up, we agreed that, let's prepare. Nobody has studied climate change and planetary health 20 years ago anyway, 10 years ago anyway. Let's prepare for ourselves, for the future ourselves, and then, who knows, we can become expert in that field, and then we can also influence the next generation. So we started from February last year, monthly meetings in WHO meeting room, and we invited Korean professors like Dr. Yoon Chol Hong was among them, Dr. Hae Kwan Chung, Mina Ha, Ho Jang Kwon, who have been already leading in this field in the area of climate change and environmental health, Dr. Ho Kim, and so on. Also, we invited young students as well who are studying at Harvard, studying in Johns Hopkins, in their doctoral program, and so on, to join. So objectives were to disseminate knowledge and insight. First, chapter by chapter, let's go through every month. So we used 2 textbooks, we call them textbooks, and then went through chapter by chapter. So we consider the Sam Meyer's textbook as a main text and Andy Haynes' book as a supplementary text. And then we matched the similar chapters, and then one of the group members summarized the main book. Another member also elaborated. It was very interesting to see that seminar, because these are senior professors, chairman, and renowned professors, but we are just like a master student or a doctoral student really learning something new. And I can tell you, we really learned a lot. Actually, as a convener, among the conveners, I worried, what if this interest just disperse? No, amazing. Still is going on, and that's why I am happy to share that story. So, because many of the members are from the academia, we wanted to promote planetary health in education, research, and policy. And also now, like this moment, we wanted to encourage national and international collaboration. So far what we have done is we finished reading these books, and now we are focusing on more research seminars. We have invited Dr. Andy Haynes once and talked about his health co-benefit studies. Amit, as you know, WHO climate change health officer, leader in the organization in the area of climate change, about the outcome of COP28 on the future of climate change and health. Ho Kim, his group published this heat wave and its impact in Korean cities, particularly impact on disabled people and so on. Okay, and then we decide to go further rather than just studying the book. Why don't we translate into Korean language so that many other colleagues can also join? So we want to publish these 2 books by next year. Actually, our ambition was to finish the publication, at least 1 book, Andy Haynes' book, and then distribute here or sell here. But as usual, it was not possible. But I'm sure by early next year, universities can adopt that book in their school coursework. And then we started translating the second book, Andy Haynes' book, and I believe we can finish by end of next year. So like this meeting, I have been introducing planetary health in a few academic groups and also some civil society organization, like Citizens Institute for Environmental Studies, which is very active kind of advocacy group. And national and international collaborations. We were so happy to have a joint meeting once, actually twice, with Japanese colleagues, and we learned a lot. We were very impressed at their achievement so far, and we all agree that we can work together in the coming years. Also, in that process, we also learned that this East Asian hub, regional hub, is also being established, and now actually established, and we can join there. We have an ambition to develop Korean model curriculum that can be used in most medical school, school of public health, nursing school, and so on. Particularly because those two books are translated and they will be published next year, we hope this group will continue to develop curriculum. In the long run, just like in Malaysia, already there is a very good national action plan set up, step by step. First education, governance, business, and then mainstreaming. We hope this group will establish a leading presence in education and research, and then move to governance and business. Also, we want to work with Asian group first through Japan, particularly Malaysia, Mongolia. So this session will be very important for us. And also, I think we will continue to not to lose the momentum that we built. Ultimately, we know this planetary health movement is not something you can do at the national level. I mean, you can do, but you cannot make much difference globally if we don't really work together. This by nature is a global joint movement. So this Korean group, and also together with other colleagues not yet joined in Korea, want to add force to the global planetary health movement to contribute to the great transition. So this is the status in Korea. So I can tell you, I think we are just out of embryonic stage, maybe infantile stage, but sooner or later we can walk, maybe run, and then maybe do marathon together with other colleagues in other Asian countries and international level. Thank you.
Thank you very much, Professor Kim Do-ko, for presenting us with the cases here in Korea. And also, we will welcome Professor Kim again shortly as the moderator for the roundtable discussion. Thank you once again. The next speaker is Professor John Ji, who will introduce case studies from China. Professor John Ji, Associate Professor at Tsinghua University, Vank School of Public Health, conducts research on the impact of green spaces, air pollution, suboptimal temperatures, and built environments on health through environmental epidemiology. He has published over 150 articles in journals such as Environmental Health Perspectives, The Lancet Planetary Health, International Journal of Epidemiology, and Natural Medicine. So please welcome Professor John Ji to the stage with a big hand.
Thank you for having me. I would like to share the planetary health update from the community in China. The first update is that I have started an undergraduate course on planetary health at Tsinghua University. It was just approved by the curriculum committee, and the course is going to be open to students outside of the School of Public Health and Medicine so that they could get an understanding of planetary health and also gain interdisciplinary collaboration. The second update is that a couple of days ago, a group of people sat together to talk about a planetary health axis systems project, which is a measurement tools to look at the planetary boundaries globally. Many people from different disciplines joined this meeting, as you can see from some of these faces here that you may recognize. And the most famous person at the meeting was Dr. Samuel Myers, who spoke to this group of people. The planetary health access system is being created to take a variety of data sources to put together in a format to measure various aspects of planetary health. So let me talk a little bit about the urbanization and planetary changes in China. This is the year 1986 on the left-hand side. It is a satellite image of Shanghai, which is a major metropolitan area in China. The average life expectancy there is merely 67 years long. You can see Shanghai, which is the big blob of city in the middle. And on the left-hand side, there's a little blob. And that little blob is actually the city of Suzhou, which is a really beautiful garden city. And between Suzhou and Shanghai, it's about 120 kilometers. And on the right-hand side is the same satellite image taken in the year 2022. And here you no longer see the borders between Shanghai and Suzhou. Two cities have essentially merged into one, and this is the trend of urbanization in megacities like China. And interestingly, the average life expectancy in 2022 in China has gone up to 77, which poses the question, does urbanization cause increases of life expectancy, or life expectancy and causes urbanization? So here are some pictures of Pudong area in Shanghai. In the year 1990, you can see across the bay was a fishing village, and now it is very much like Manhattan. In another city in China, Shenzhen, in 1982, this was the tallest building, and this was where the opening and reform of China really took place. And this is a current picture of Shenzhen. You can see the buildings keep getting taller, and now the Ping An International Finance Center is 115 floors above ground level. So is this developmental trend going to continue? What does it mean for planetary health, and what does it mean for public health? For sure, urbanization is going to continue. By the year 2030, China's government expects that 70% of the country's population, so roughly 1 billion people, are going to be living in cities. The Lancet Commission on Healthy Cities in China show the total population increasing, but the rate is slowing down because of low birth rate. The urban population, especially for the elderly, is increasing at a constant rate, and so has the built-up impervious surface around these cities. The urban and rural life expectancy gap is 6 to 7 years, and as I understand, this is one of the biggest around the world. So question is, does the built environment affect health? It has a causal relationship. Or, as an epidemiologist might mention, what are the confounding factors? What is the underlying factors that's driving changes in the built environment and driving changes in health? Or perhaps it's a reverse causation, that longer life expectancy and longer health is causing changes to our built environment. Let's look at some statistics. China has set 2 national plans for life expectancy. By 2030, the goal is to reach 79 years old, and by 2035, the goal is to reach 80 years old. What does longer life expectancy mean for the world in terms of planetary health? I don't have all of the measurements that Professor Myers showed earlier today, but I have this one graph, which is energy use per person. So China is one of the most populous places in the world, and the per capita energy use is closing in on the per capita energy use of European Union. By all projection studies, the life expectancy is going to be above the national goal of 79 and 80 by quite a bit. But interestingly, the male and female life expectancy gap remains. A couple of studies have tried to explain this. This is the Lancet Commission on Healthy Aging in China. One of the major lifestyle differences on the left-hand side is smokers versus non-smokers among male and female. There's a lot more male smokers than female smokers, so that could be one of the reasons for life expectancy gap. The other aspect is the concept of healthy aging. Longer life expectancy doesn't mean that there are fewer diseases. If the incidence of disease stay at the same age, then that means more people are living longer with more morbidity, therefore increasing the burden of disease. So the best case scenario is that there could be expansion of life expectancy, but a compression of morbidity, meaning that the disease onset happens later in life and for a shortened amount of time. This is where, interestingly, some of the climate angles might be super interesting, because China has pretty ambitious goals for the national determined contribution as part of the Paris Agreement, including peaking of CO2, reducing CO2 emissions, and what I'm mostly interested in is the increase of forest stock volume by 6 billion cubic meters. Now, this is the size of England and Ireland combined. Most of the Chinese population, they do not live evenly throughout China. 94% of the population live on the east side of this line in coastal cities. And planetary health and climate change adaptation is going to have very regional, distinct regional characteristics because of the various temperature zones in China. China has pretty much all of the temperature zones around the world, such as the deserts you can see on the inner Mongolia, and all the way to the south you can see Hainan Island, which is the Hawaii of China, which is a tropical wet climate. Therefore, the number of heat wave days and heat wave definition need to be adopted to regional attributes. This is the heat wave days in China by region, what the 99th percentile of temperature is. And because of urban heat island and the expansion of cities, cities used to be a place where people live longer, but because of urban heat island, now we have more acute impacts of heat wave in the summer. And we show this using our cohort studies. The early warning system in China need to adopt a relative temperature. Currently, it uses an absolute temperature using a very easy to understand color system, which is great because it allows more people to understand early warning, but it does use a absolute temperature. For example, 40 degrees, 37.5, or 35 degrees Celsius. One health and infectious disease is an area where the planetary health thinking and climate change come into play. These are regional outbreaks of vector-borne disease, including dengue, rodent-borne disease, and water-borne disease. So you can see some regional variation by types of disease. China, with COP29 ongoing right now, looking at co-benefits from China's NDC and health might be a good research direction. One area I'm interested in is the green space. Interestingly, and contrary to popular belief, green space is actually increasing around the world in urban areas, and most of this is coming from China and Europe. In fact, 25% of the 5% gain came from China. We ran cohort studies looking at green space changes in populations, have found that it protects against mortality, lowest to highest quartile, about 4.5 years. And this is a sponge city in China, which is used for flood prevention, and it creates urban green spaces and could have indirect and direct impacts on health. In the city of Shenzhen, more and more parks are being created as well. We're especially interested in how green space might be able to mitigate against heat wave mortality because of the city geometry, heat retaining properties, and how urban blue and green space might interact together. And we have conducted some novel cohort studies on this topic. And lastly, I just want to show some images of cohort study data collection. We must take into account some of the realities of different socioeconomic differences in China. So on the top here is a household that uses biomass for cooking and heating. If we spend too much time talking about outdoor ambient air pollution without thinking about indoor air pollution, it really misses the mark. And on the bottom here is a newer home where natural gas is being used and lowering indoor air pollution. And technology can be used for planetary health and climate change mitigation. China produces some of the largest number of photovoltaic PV projects, and these could be used. I just want to have a little advertisement because Dr. Hashizumi is here. We created a Lancet Regional Health Western Pacific series on climate change adaptation, and we're going to continue to work on this with planetary health thinking. Thank you so much.
Thank you, Professor John Ji, for giving us the opportunity to take a glimpse at the roadmap and action plan of China. And ladies and gentlemen, we will proceed right on to the next session or the next speaker. We're going to focus on a case study from Mongolia. The story of the Mongolian community will be introduced by Cherendulam Shakdarsuren, Director General of the Climate Change Department at the Ministry of Environment and Tourism in Mongolia. Director Cherendulam Shakdarsuren serves as a diplomatic advisor to the UNCCD COP17 Preparatory Office and has established the Mongolian branch of the Healthy Cities Network and the Healthy Cities Alliance, where she holds a board position. So let's welcome her with a big hand.
Thank you very much. Very good afternoon to ladies and gentlemen. So first of all, I'd like to introduce myself. So my position is changing right now because of the government of Mongolia is organizing UNCCD in the COP17 in Mongolia in 2026. Due to this situation, so I'm moving to Ministry of the Foreign Affairs, and then so I am working as role of advisor of the Ministry of the Foreign Affairs for the Preparedness Office. And at the same time, also the director of Mongolian chapter of Alliance for Healthy Cities. That is my very much in the academic in the role, also very much in the community role. So my presentation is covering about how is the climate change in Mongolia, also how to influence the health situations impacting the climate change, also what is our response in the planning and the policy from the government of Mongolia, also what is our future actions. So it is very short in the presentation, so the way I can't covering all of the issues just in the one slide, also 10 minutes. But anyway, I'm trying to introduce such the presentation to you. So this is the Mongolian climate change and the current situation scenario. So Mongolia's annual mean temperature has increased by about 2.4 Celsius over the past 80 years, which is nearly in the 3 times in the global average rate. At the same time, due to the desertification and reduced in the precipitation, 70% of Mongolians in the grassland is risk of desertification, impacting the water ability, same time the food insecurity. So also in cities, also the main problem increasing in the daily in the temperature, especially in the increasing in the hot and the very hot in the days. And same time, especially in the Gobi region, dry in the area, there happen the respiratory disease, health of the livestock, and migration across the large and the distance because of the hairdress in the life, and then so tick-borne the disease and the water sources. They are under one of the problem, especially increasing in the temperature. And then, so how is the impact of the changing in the rainfall and the patterns, especially in the urban area, including in the rural area? For this in the matter case, of course, they have the direct impacts of the mortality and morbidity from the polluting. Also the image and the access such as the pasture land, settlements, and equipment, infrastructures, reduces the livelihood and the security. Of course, at the same time, livestock during the dry in the summers, that is also one of kind of the big and the situation, especially in the limited in the preparation. For this matter case, we have some kind of the risks of the food insecurity, nutritional deficits, and also role in the urban the migration. Those the issues have our risks at this moment. In this situation case, what is our responses? What is our government plan? And then so since the 2022, we worked together very much in the multiple sectors in the sit together to make the national adaptation strategy. For the national adaptation strategy was approved by National Committee of the Climate Change in just in this year in March. And then so that's the strategy is covering 2024 and 2030. That is the midterm the planning procedure. So we picked up the main 8 in the priority area. That is including in the borders, the water, the forests, disaster and the management, livestock and the pasture land, crops and public health, and livelihood and the social care. So in the past, especially in the climate change policy nationwide and the planning and the actions, we covered the main priority in the 6 in the sectors. That is including livestock, crops, forests, disaster management, etc. But not including in the public health and the social care. And then so this is in the very capacity building, also practical in the action in city level. So currently, city level, the climate change and the actions, also healthy city and the actions is, for us, this is in the very beginning of this stage, to make the capacity building, also make the very much the comprehensive in the training among the local authorities, the local and the staffs. So mainly in the Alliance for Healthy Cities and also ICLE, GGGI, those in the international agencies are very supportive from managing human resources and also capacity building and the actions in Mongolia. Just 2 years ago, we organized Climate Change and City in the Forum. That is all of the stakeholders, many stakeholders in the city together, discuss about the climate change, and then so what is our roadmap for the city level, especially for the impacting in the climate change issues, also prevention, and then so for adaptation, the mitigation actions, and these implementations, etc. So for that in the forum is also on the main the stakeholders included in the UN agencies, also international development and the partners, donor and the partners. That is very much helpful to understand about the cities in the situation, especially in terms of the climate change and the issues in Mongolia. So now I'm back to the National Adaptation Plan. How is the measurement, the principle, and the actions in public health sector in National Adaptation Strategy? Mongolia is the 56th country of approved the National Adaptation Strategy in the world. But anyway, public health and the action is very much in the beginning of the actions. Especially in the preparation level, we should make very much the comprehensive, the trainings, the workshops among the main actors. Also, the expanding in the training awareness in the program among the health sectors, the people, and then so build the intersectoral and the local engagement system to support the adaptation, the actions. Also, same time, the protecting the public health and the actions. That is the main actions. But so we need more clearing the data and also more clearing the information about the public health impacting the climate change. Because our current studies is a little bit old, and then so usage is a little bit difficult to making the policy. That isn't the one kind of the challenge to us. And then so what is our next in the practical in the actions of the climate change and the issues, especially city level? So Minister of the Environment, very supportive for the climate change and the actions, especially the sustainable in the city, healthy city and the issues. Then so from the government of Mongolia, UNDP, that two the main actors jointly work together for the improving the sustainable city in the actions in Mongolia. So we got the JEF, that is UNCCC, have some funding and the mechanism. The main in the funding mechanism is JEF, Global the Environment in the Facility, and also GCF, that is Green in the Global in the Green in the Fund. So JEF in the prove it in the our in the Sustainable City Integrated Program for Mongolia. That is in the around the $6 million US, but it is in the a small in the amount of money. But anyway, so that is for the very much in the comprehensive and the technical assistance for Mongolia for the developing the sustainable, healthy, smart city, especially in main the cities of Mongolia. So from the next year, then so the next for 5 years, we will implement sustainable city in the actions, especially including in the climate in the friendly city actions in Mongolia, for Mongolia. So now, so I'm moving to the conclusion of my presentation. So what is the key challenges, especially for the city area and the climate change and healthy city issues? That is, of course, that is funding and the issue. Then so infrastructure, equity, justice is also very important for that in the matter. And then public and awareness. That is also one of the issues to us. The key learnings from the Mongolian, the practical and the information. So first of all, much in the collaborative in the efforts between the main, the partners, and also global and the partners. That is also in our learning. And then so small in the scale, community-based interventions. This is also very important, also very in the positive in the outcome at a local level. What is the future goals? Very in the closely, very in the near the time, so we will expand health and the monitoring. That is the facing and the challenge, especially related to health and the data and the collection. Climate and the health, healthy city, we need in the principle and also very, very much in the simple indicators. In Mongolia, yes, Mongolia in the cities, we are working together for the data and the matters with the university and also local and the governments, also WHO in the country office of Mongolia. Now, promoting the renewable energy, that is very important in the goal, because NDC also already introduced for the data and the goals. For the reduction of the air pollution, also we should implement actions. Reduction of the air pollution should be in the 20% to 2030. So that is the main principle of the actions. Next, the point is to 2030. So we will expand renewable energy by 30% of the current in the baseline. That is very big in the commitment to the government of Mongolia. Then so educational initiatives, that is also very important the issue. So especially through the young and the generation, so we can make the very good in the educational models to site of Mongolia. And then engagement in the opportunities, of course, that is main the situation very general in the issue, public and the private and the partnership is very important. We should be strengthened for the data in these situations, especially for the climate change, improving the urban health outcomes. Okay, thank you very much for your attention.
Thank you very much, Director, for giving us insights into Mongolia's urban as well as environmental health initiatives. And now you're going to delve into another case study, this time from the Hong Kong community. The case study will be presented by Professor Eric Ip from the Faculty of Law at Hong Kong University, and he will connect to us live online. So let's welcome him with a big round of applause. So Professor Ip, are you connected to us?
Yes, can you hear me?
All right, so you may begin.
Thank you very much. Good afternoon. Hello from Hong Kong. My name is Eric Ip, and I'm a co-director of the Center for Medical Ethics and Law at Hong Kong University. Our center, hosted jointly by the medical and law schools, focuses on legal and ethical issues in medicine and health, including planetary health. I am also a member of HKU's Institute for Climate and Carbon Neutrality. This new institute brings together researchers from different faculties to investigate impacts of climate change on ecosystems and humans, and I'm the only member from the Faculty of Law. My community is based in Hong Kong, which is an autonomous special administrative region of China, and Hong Kong, alongside with Macau, Shenzhen, and Guangzhou, are part of the Guangdong, Hong Kong, Macau Greater Bay Area, situated in the Pearl River Delta region. So I'm offering a perspective from southern China to complement to supplement what Professor Ji has presented earlier. The Greater Bay Area spans 56,000 square kilometers and includes 11 vibrant cities with a combined population exceeding 71 million. These cities are significant energy consumers as well as carbon emitters. And the Greater Bay Area is also known for being particularly vulnerable to extreme weather events, climate-induced floods, and heat waves. And we are on the northern coast of the South China Sea, which is expected to rise by 34 to 79 centimeters by the year 2100, which is 20 to 30% higher than the global average. And I would like to remind you that the year 2100 is not really that far away. Just look at those innocent faces of kindergarten children around our communities. They are likely to witness the year 2100 in the early 80s only. With the rise of life expectancy, these people who are already in existence will be threatened by climate-induced floods, weather events, and rises of sea levels. And so the climate emergency is a rather urgent problem for us to tackle, especially for us who live near the coastline. Having a background in law and bioethics, I'm privileged to have been at the forefront of the emerging fields of planetary health, law, and ethics. I've recently focused on these areas in my work, which have been published in both law and health journals, such as the International and Comparative Law Quarterly, as well as the Lancet Planetary Health. I believe that humans have an inherent right to thrive, but this is only achievable if we respect the natural world. My research focuses on promoting planetary health from a rights-based perspective, particularly emphasizing the emerging human rights to a healthy environment as recently recognized by UN General Assembly Resolution A/76/L75. I'm also intrigued by the rights of nature, where natural entities like rivers and ecosystems are granted rights of existence and regeneration in different countries, from Ecuador to New Zealand. I am particularly interested in exploring how international environmental law and global health law, which are currently fragmented, can be made more cohesive by emphasizing the preservation of the natural foundations of public health, which unites both areas together. I'm currently working on the first book on planetary health law to be published by Cambridge University Press next year. Being one of the very few researchers in Hong Kong, explicitly focusing on planetary health, I have actively promoted awareness of this critical issue over the past year, which I will describe as the year of awareness in planetary health in the Hong Kong community. So a number of seminars and meetings on planetary health were unprecedentedly organized in Hong Kong this year, and I participated in most, if not all of them. For instance, as co-director of the Center for Medical Ethics and Law, I participated in seminars and meetings to raise awareness of planetary health, not only among legal professionals, but also among NGO workers, lobbyists, nurses, and medical practitioners. For example, I co-hosted a seminar with a former Deputy Secretary of the Environment of the Hong Kong government for leaders from the non-profit sector. Additionally, I spoke at the Hong Kong International Nursing Forum earlier this year, where the theme centered on nurses' impact on planetary health for the very first time. This forum attracted nurses and nursing academics from different continents. And just a couple of months ago, I had the privilege and honor of speaking at the annual scientific meeting of the Hong Kong College of Community Medicine, which is the leading professional accreditation body for public health physicians in Hong Kong. And this event marked a significant milestone, as it marked the very first time that planetary health became the central theme of this prestigious annual meeting, which I think played a critical role in mainstreaming planetary health in our local community. Our research at HKU aims to influence policymaking and public discussions on using constitutional and legal tools for environmental protection and climate change response. By exploring the potential of constitutional instruments and legal instruments in these areas, we hope to provide invaluable insights that can guide both local and transnational policy makers. So it is concerning that Hong Kong's government's Climate Action Plan 2050, which aims at achieving net zero by that year, is actually a non-binding policy document which doesn't even consider the use of law or legislation to address climate change. This omission, in my personal opinion, is notable, given Hong Kong's reputation as a high-earning international financial center with a relatively high life expectancy of about 83 years old, and the lack of regional leadership in the Greater Bay Area, coordinated 11 cities with varying life expectancies and facing different sorts of climate challenges, simply highlights the need for more robust measures, more robust legal and ethical measures to address climate change. In addition to my research and advocacy efforts, I teach courses on global health law, including topics on planetary health, to both health and law students from both the postgraduate and undergraduate streams at HKU, and through the Center for Medical Ethics and Law, which offers an LLM, a Master of Laws in Medical Ethics and Law. I aim to educate and inspire a new generation of health and legal professionals and policymakers dedicated to tackling challenges posed by the climate crisis by offering a compulsory course on global health law and development. So our community aims to develop policy briefs that can provide useful guidance to public health decision makers and also environmental and ecological policy makers, as well as courts involved in environmental and climate change cases in Hong Kong and potentially the rest of the Greater Bay Area. So to conclude, what we seek to alarm our community is the fact that humans are not superior to the planet. We are part of it. A healthy planet is vital for human health worldwide, not just in China's Greater Bay Area. And although the law has contributed to issues like climate change and pollution in the past, it can make amendments by safeguarding a healthy environment and even acknowledging the rights of nature, if not also the planet's own right to health. So thank you very much. That's my presentation. Thank you.
Thank you, Professor, for that presentation and also for laying out the roadmap and action plan for raising awareness of planetary health in Hong Kong. And now we will again connect abroad. The next lecture will be by Dr. Eve Chang, the science officer from the Future Earth Taipei Health Working Group. So let's connect to Dr. Chang. Are you connected to us?
Yes, can you hear me?
All right. Let's start with a big round of applause.
Thank you. Oh, can I share my screen? Can you see my screen now?
We cannot see the presentation information yet, the slides.
Wait a minute. How about this?
Not yet.
Okay.
We
Let
do
me
see
try
you on
again.
the screen, though.
I'm sorry. Let me try again. How about that? No?
Not yet.
Is it working? No?
No, we can only see
Oh,
you.
I'm sorry.
Which is good. It's good that we can see you.
No, but I want you guys to see the slides.
Yeah, I can see it.
Really? You can see online?
Yeah, from online, I can see it.
Online, my screen, right?
Yeah, right.
But, okay.
Maybe it's a screen in the venue.
All right, we're going to try to connect once more to her and figure out how we can share the slides together.
Okay.
Yeah, from online now it's okay.
Okay.
Maybe to our audience right now here, I think this late afternoon may be a good time to stretch a little bit before we continue with the next presentation. So bear with us just a little moment.
Is there anything I can do?
Yeah, I think from the online, I can see the presentation very clearly.
Okay.
All right, Dr. Eve Chang. Oh.
Yes.
I think it's working. We are seeing you and also the slides. So you're.
Oh, good.
Yes, you will just have to go through the slides in this format right now. I think it'll work out. All right.
So it's working,
so why don't we
right?
start yet once more with a big round of applause.
Okay. Good afternoon, everyone. My name is Eve Chen. I'm a science officer at the Center for Sustainability Science at Academia Sinica. On behalf of Professor Candace Long, I'll give a brief introduction of the Futures Taipei Health Working Group. The Futures Taipei Health Working Group was established in 2019. Currently consists of 30 members from universities and research institute across Taiwan. Distinguished Professor Jenny Su. She's the former president of National Cheng Kung University, which is one of the leading universities in Taiwan, serves as the advisor of the Health Working Group. And Professor Candace Long, research fellow and deputy director of the Research Center for Environmental Changes at Academia Sinica, serves as the convener. And the Center for Sustainability Science at Academia Sinica provides funding and manpower to support and organize the group's activities. So the main focus of the Health Working Group is to promote sustainability science in health-related research, emphasizing transdisciplinary approaches, stakeholder engagement, and solution-oriented studies. We promote this type of research domestically and also seek international collaboration through the Belmont Forum Collaborative Research Actions. One of our members, Professor Wang Yuchun, has been received funding support for the CRA of Climate, Environment, and Health. And Professor Wang will be with us tomorrow in the closed-door meeting. The research focus of this working group includes health adaptation to climate-related impacts and carbon reduction in healthcare systems. In recent years, we focus on two research directions, which are nature-based solutions for health adaptation and carbon reduction in hospitals. So we have organized several discussion meetings, inviting scientists and stakeholders from diverse backgrounds to help identify key research gaps that need to be addressed to facilitate the development of health adaptation strategies and the implementation of carbon reduction practices in Taiwan. So we organize the serious activities to encourage discussions on important research gaps, to explore innovative ideas to address them. So our activities include training workshops, webinars, and symposiums. This is one of the example of the training workshops that took place back in 2021. Which is the TDR workshops. The main purpose is to build the capacity of mid-career and junior faculties, postdoc, and PhD students, enabling them to apply TDR skills in their own research. And this is another training workshops take place last year in November. As you can see from the theme, linking nature and health. So all the sessions were conducted in a much greener environment. Additionally, we organize international workshops for Asian scientists on using low-cost sensors in air pollution and health studies, allowing them to learn about innovative technologies. So in this workshop took place in September this year in Malaysia, and we have speakers from Germany, Korea, and of course, Professor Candace Long. And we have participants from Vietnam, Thailand, the Philippines, Malaysia, Bangladesh, Indonesia, Mongolia, and Myanmar. This workshop will be take place in Mongolia next year. In addition to training workshops, we organize webinars. For example, in 2022, we held 5 international webinars featuring speakers from around the world. And we also conducted 3 domestic webinars in Mandarin. And of course, we organized the symposiums. The Center for Sustainability Science, Academia Sinica, and the Future Earth Health Con co-organized the official launch event in Taipei, Taiwan on May 2019. This event took place about 10 days ago. We have speakers from UK, Sweden, and Australia, and together with Taiwanese scholars, we bring them together to discuss the link between climate change and health, and to explore methods for calculating and reducing carbon emissions in healthcare sectors. As I mentioned in the beginning, the research focus of this working group is on the mitigation and health adaptation of climate-related impacts, which aligns well with the scope of the Planetary Health Alliance. Therefore, we are pleased to join the East Asia Hub and look forward to more collaboration with you in the future. Thank you.
Thank you very much to Dr. Eve Chang for introducing us to the Taiwanese community's activities. And now let's proceed with the final lecture. And for that last lecture, we will welcome back Dr. Jamila Mahmood, who previously introduced us to the Malaysian community. She will summarize the activities of the global community and provide detailed insights into the global roadmap and action plan of the Planetary Health Alliance. So let's welcome her another time with a warm round of applause.
Thank you very much. How do you summarize such a rich set of discussions? What I can say is it's exciting that Asia is really stepping up. We've heard a range of programs and thoughts from the region. I think on the global front, we have now a roadmap that is solid, and it's very encouraging to see that countries are using this roadmap. And I think this is going to be very important. I will try to pick out some of the common themes I heard. One that I heard very clearly was that it could be a problem with nomenclature. The word planetary health is sometimes difficult to translate. And I think, this is not just in Korea. I think even in Malaysia, sometimes we have to think of how we actually portray planetary health. Maybe in the 10th anniversary of the Lancet Commission, it's time for us to re-examine how do we maybe have a much more united way of describing things. What I also heard is that the development of planetary health, particularly in this region, is in different stages. There are some which are more advanced and some which are still quite nascent. And I think this is good. I think that there's a lot of cross-learning that can happen. It was very encouraging to see that even in Japan, for example, the Ministry of Environment has mentioned it in the 6th Basic Act on Environment. The Cabinet Office has adopted the language of planetary health in SDG implementation. It's good that Ministry of Health is recognizing climate and health risks, and the businesses themselves are looking at the interest between the cross-societal interests in planetary health, which is great to see. In terms of looking at academic progress, there's been a lot of research, quite rich. Korea translating the 2 textbooks is a phenomenal task. I think is excellent, really encouraging to see that. But the fact that now, in Tsinghua, for example, there are undergraduate courses in planetary health. Normally, we would think that it is a postgraduate program. We've also developed it as undergraduate, so it's very nice to see that a real degree program is being developed. I think there's so much learning from that as well. There's also measurement initiatives going on, this whole issue around the planetary health exit systems. I would encourage that, we also look at how that ties in with the roadmap itself in terms of planetary health assessments. And very clearly, urbanization is very, very clearly an important factor in Asia. Asia will be the most populous region in the world. At the moment, it's still 53% of population, which is major, 4.8 billion people. It will be the major driver of economy in the world. By 2040, it will be accounting for 50% of our economy, and therefore development has to be done in a way that will protect the planet and people. I wanted to maybe point out how Mongolia has shown us a really good way forward in terms of really taking the basic local vulnerability mapping, but also reaching out to partnership and really developing tools and mechanisms where, certain areas of focus, recognizing the rural-urban divide and the reality of climate change, but also capacity building for national adaptation. I think this is very encouraging. It is something, I feel that Mongolia is walking the talk. I think there's a lot that we can do together, a moment for international and regional cooperation as well. I was particularly struck by Hong Kong that looks at it from a legal framework, which is very encouraging as well. And that, this whole year of awareness and taking environment and health law and trying to reduce the fragmentation of law as well, and community developing policy briefs, and the Hong Kong Climate Action Plan. On Taipei, the Future Earth Taipei Working Group, it's good to see that they are really focusing a lot on climate-related impacts and carbon reduction, very much in line also with what Malaysia is doing. And I think that, overall, what we are seeing now is a real opportunity, a momentum that is growing. What I feel we need to start looking at is how do we coordinate? How do we learn from each other? How do we build on each other's strengths? And how we, almost create a little bit of a compendium across the region on what are the possibilities. How do we infect other regions as well to take the learnings from Asia, which is robust? And last but not least, I just want to point out the very important role that World Health Organization has to play. I think Professor Kim, you being here and your insights were very, very important. I think that, we are facing a serious planetary crisis. The more we collaborate and work together and break those silos, even in large institutions and across the region as well, is going to be very critical. So I hope I've done some justice to a very rich discussion. But overall, I think the key takeaways I would like to maybe highlight is the time is now for evidence to action. And this is certainly something that we have said very strongly in the Planetary Health Annual Meeting that happened this year. And just to mention that the next annual meeting will be in Rotterdam, where we hope we can continue taking the discussions forward. The other thing is that we need coherence. We need a joined up approach within the region and between regions. We also need to engage with the ongoing processes, just keep pushing the roadmap and action plan. Let's identify niche areas. Let's grow the movement together, not just health professionals, but also beyond health professionals. And then, we have to appreciate the efforts in the region. And thank you very much again for such a rich discussion.
Thank you very much once more to Dr. Jamila Mahmood for the wrap-up and also about the summary of the global community. So I think this would be a great opportunity to thank all of our speakers from all around the world with another huge round of applause. So we have one more discussion left. We're going to set up the stage for that discussion, and this is going to be a very lively one, I can expect. We're going to have our panelists here on site, as well as those who are going to connect with us online, and also additional panel members that we have not seen before during the speeches. So before we kick off, let me introduce the members of this discussion. We're going to have our chair, Professor Kim Nok-ho. He is going to be the chair for this session. And the other members are going to be Professor Keiko Nakamura from Tokyo Medical and Dental University, who is going to join us additionally for this. And also Professor Chiho Watanabe and Dr. Eve Chang, who we met before. And we're going to also have Professor Jinwon No from Yonsei University participating online as well. So once we get ready, we're going to have our members on the stage as well as online. So you can see here on the screen the members of the panel discussion. So we're going to have a variety of perspectives on this topic from various nations. So it's going to be an exciting discussion. Let me again introduce all of the speakers and panelists that are also going to take to the stage. So again, the chair will be Professor Kim Nok-ho, and our other members are going to be our speakers from before: Samuel Myers, Jamila Mahmood, John G, Cherendulam Shakdar Suren, and also Keiko Nakamura, who's going to join us online. And also Eric Ip, who joined us before as well, is going to be online as well. So give us just a few more minutes until we can begin with the discussion, which will be the final part of our first day of the second World Health City Forum. Our chairperson is already getting onto the stage, so maybe this would be also a good time for our other panel members to now slowly come up to the stage.
Good afternoon, everyone. Last 25 minutes. It's a long afternoon. Thank you, Dr. Mahmood, for excellent summary of the presentations. So in this discussion time, we want to invite invite two more additional new experts. Dr. Keiko Nakamura, who is a professor and head of Department of Global Health Entrepreneurship of Institute of Science, Tokyo, former Tokyo Medical and Dental University. And Professor Jinwon No, who is connected by online, and Professor and Chair of Division of Health Administration of Yonsei University. Also, we are going to invite Dr. Chiho Watanabe one more time for his comments, who is a professor and dean of the Inter-Facility Initiative in Planetary Health of Nagasaki University. So I don't want to put my own question here. I will leave it to you to make any comment. I think all the challenges, opportunities were so well elaborated. Actually, that was my question. What do you think about the main challenge and main opportunities, lessons? But I think all presenters already so nicely presented. So I will not throw that question, but I invite your comment freely based on your own experience. Particularly, Dr. Nakamura has been a long time leader in the regional and global healthy city movement. So from that historical perspective, I guess Dr. Nakamura can add some more insight to this session. Dr. Nakamura, please.
Yes, thank you very much, Dr. Kim. So today we had a very rich time. So when the World Health City Forum started to think about planetary health in this region, we didn't know who are there, what they are doing. But today, we had rich stories from different communities, from academics, both public health, environment science, built environment, and then also from so not only academics, but also some of the city efforts and government efforts, and then so they are connecting. I think the strengths of planetary health, if we have the multidisciplinary partners, we have strengths. And then also, so to listen to or communicate with other communities, people have deeper understanding and also the imagination what will happen. So therefore, it is obvious for us. So different communities have different approaches, but when we see each other, what are the additional approaches, etc. And then many of us have existing resources, existing networks, and then bring together, and the first community-wide, and then individual community, maybe so in a transdisciplinary network will expand. Not only academics, but also city leaders, government sectors, and then also private sectors we can involve. So this was a very good learning, and then what we have to do is to make this network more stronger. Thank you.
Thank you, Dr. Nakamura. I really admire your leadership that made the healthy city movement of the past 30 years possible and such a success. We hope, actually, we may go on the same track of success, maybe much faster way, expressway.
Yeah. So if Dr. Kim, if I can add the issue about the healthy cities, well, it has 35 years on history of healthy cities, city-focused urban development programs. They didn't know planetary health term, but so they have developed how to live together with existing environment, and then how to value blue and green spaces, etc. So therefore, once they get the idea of the philosophy of planetary health and also the evidence, they are much encouraged. And then also to respect to the traditional way of thinking, or the way to live with nature, that was what they have thought. And then the planetary health thinking can strengthen. So that way is it's good. But actually to make things practice in action, so many challenges. But learning from experience and the practices different communities, and then actually that is strengthening healthy cities to work planetary health area.
Yeah, thank you very much. Next, may I invite Dr. Jinwon No as a new contributor.
Thank you, Riyad.
Dr. Jinwon No, connected, right? She is working to set up a new research center for planetary health in her university. That's what I heard. So I think there is a very fresh news on the idea and where we are now. Dr. No, please. Dr. No, you are invited to contribute now. Maybe audio connection was not optimal. Dr. No, can you hear us?
Oh yeah, now I can hear you.
Okay, great.
Sorry.
Great, okay.
Yeah.
We just finished Dr. Nakamura's comment, and now we are inviting your comment. And I just told to the audience that you are working with the university to prepare a new research center on planetary health. So could you please share that progress? And if you were with us during the presentation, please add your comment as well. Thank you. Dr. No, please.
Can you see my slide?
No, we don't see.
We can see online.
Yeah.
Oh, we can see from online.
From online, yeah.
Yes.
It can be seen
Can you
online,
see my
but not
slide?
here. Maybe we just...
I'm sharing the slide right now.
Yeah, yes.
Okay, now we can see. Yeah, great. Yeah, please go ahead. We can see.
Okay.
Thank you.
Okay. Good afternoon, everyone. As Dr. Kim introduced me, my name is Jinwon No, Chair of the Division of Health Administration in Yonsei University. Today, I would like to introduce the Institute for the Planetary Health that is processing now at the Yonsei University. So the table of contents looks like this. And then here, how the Institute was founded. Many people here will be well known about it, so I will summarize shortly. So according to the 2020 UN developed program, the planet's challenge mirror is facing society, that the inequality in human development are multidimensional and persistently growing, and that climate change as one of the most dangerous changes at the global level. Everything from COVID-19 to climate change is exacerbating social division. The effect of planetary environmental change do not fall equally on all people, with socio-economically disadvantaged population bearing a disproportionate burden. Therefore, there is a need to examine the disparities that lead to unequal and unfair health outcome. So, and it should be convergent approach and cooperation with multidisciplinary. And then those are the background and goal and vision and our key research area and value for the Yonsei Institute for the Planetary Health. The existing domestic institutions mainly focused on the environment health or politic researches. So this institute has a difference in that it supports the convergence of Korea advanced IT, AI, and big data technology and healthcare to provide support related to data-driven global health. The Institute for Planetary Health is intended to be established with the aim of supporting collaborative research and education to solve these planetary health problems. Based on those needs, the Institute intended to serve as a platform to promote fair and effective health policies and practices in cooperation with various actors such as academia, civil society, member countries, and multilateral organizations. Through this, we intended to contribute to solving global problems related to human survival, development, health, and welfare, not only in Korea, but also at the global level. Those four sections, our main field is policy governance, environmental ethics, health and care, big data, AI. We are seeking for the Convergence Multidisciplinary Research Center. And this is our organization structure, aim to contribute to the promote of population health through multidisciplinary research for sustainable and inclusive global health. To this end, experts from various fields such as health science, medicine, nursing, data and digital health, humanities and engineering, philosophy, including environment engineering. From Yonsei University, our 13 tenure-track professor is working together to support related establishing the research center in terms of education, research, and policies. And we also have a consulting group reading by local Kim, today's discussion chair. We have a monthly journal club for the planetary health. You can see that those key members mainly consist of WHO member, Korean WHO members. So based on a system of cooperation with various stakeholders, we seek practical way to address the global health crisis, develop innovative solutions, and promote health equity in low-income and developing countries. And we are now working with the U.S. humanitarian and expert professor Diane Majoran, co-director Tufts University, she is a professional in terms of supporting the vulnerable people in terms of humanitarian aid. And then we have a MOU signed with the Ghana government ministry. We are trying to make Institute for the Planetary Health at the simultaneously because Yonsei University is building a university in Ghana right now. So we are trying to make two simultaneous institutes for the planetary health, one in Africa, one in Korea. And then I wanted to say we are very open to collaborate Planetary Health Alliance here all. And those are our annual plan. And the Institute for the Planetary Health will create various expected effects in academic, policy, and social aspect. Okay. Okay, thank you very much.
Thank you very much, Dr. No. It's exciting news. All the best wishes, and thank you for inviting Planetary Health Study Group as a consulting team in your endeavor. Your summary of the academic, policy, and social approach exactly aligns very well with the Planetary Health roadmap and action plan. So I'm sure once established, the center will play a key role in Korea in planetary health movement. Thank you very much, Dr. No. Now,
Thank you.
may I invite Dr. Chiho Watanabe, just briefly, from your point of view, with enormous experience in public health, global health, and recently in planetary health in Japan. So based on your experience, would you share your observation of all the presentation in this afternoon? Thank you.
Thank you. No, I think we have seen the various phases of the along the development of the planetary health and, in the various countries, but I think I'm very much impressed by the successfulness of the raising up in several communities, and particularly not only in the academia but also the non-academia communities. And in case of Japan, I think that we most of us working for the planetary health is coming from the public health area, and the others, some are from the natural science area, but we have seen very few people from the social science and humanities. I think, for example, from Hong Kong, we have an expert of the law. And I think that these kind of activity is very important for us in Japan also, but also the other countries. So I think even within the academy, we try to involve the many disciplines, and at least the collaboration between the natural, social, and the humanities are very important and indispensable. And I'm very much amazed that some countries already succeeded. That's my impression. Thanks.
Thank you, Dr. Watanabe. Excellent comments. Now we have 8 minutes, so I think we have 4 more people to comment. But Sam, would you like to start? Thank you.
Just to say that I'm so impressed and excited really to hear the richness of all of the approaches that are going on all across the region, many very different kinds of approaches. And it reminds me, a couple of years ago, we started to notice something similar in Europe where, multiple different countries were beginning to develop new courses, new degree programs, new research initiatives, new policy applications, new centers and institutes, and they were all trying to solve similar kinds of problems. How do we integrate planetary health into medical education or nursing or public health or undergraduate, and should we have certificate programs? How do we reach out to our governments? And I think we're seeing something very similar in this region as well, and it just makes it that much more valuable to start connecting each other so that we can learn from each other's examples and not all be trying to solve problems in parallel. So I'm very, very excited and enthusiastic about everything that I've heard, and I look forward to seeing how we can build this into one more integrated community.
Thank you very much. I forgot to count connected speakers. Sorry, Eric Ip and in Hong Kong, in Taiwan. So really, we don't have much time, but I will give 1 minute to make your, your comments, kind of summary comments. So may we, start from, Mongolia, then from Mongolia, and then come to this way, and then finish with online. Thank you.
So anyway, many thanks for organizing this session. So for the current in the planning, especially in the short in the term, the planning case, and we need the more and the different the capacity building and the actions between the different the stakeholders. That is very needful. Second point case, we need the more and the models and the projects for the health friendly, environment friendly, and the city actions for the countries. Of course, the countries are different in the countries. Also, cities are very different. But in the one in the country case, also cities are very different. And then so we need the model and the projects for that and the action. In that case, we can learn each other how to good in the actions for climate change and health issues, and plus in the city local level and the issues. And third, the point is, of course, the political and the commitment is very important, not only in the health sector, not only in the environment sector. We can't do anything. So especially the mayors and the commitment of Hawaii is very important, I think so. Thank you very much.
Thank you. Next, John, please.
Thank you. One of the major learning for me today is hearing about Mongolia's National Adaptation Plan. And it's for 2024 to 2030, which is the same as the one in China. And I've actually participated in the writing of the Health National Adaptation Plan, which just came out. And I was at those meetings, and I actually mentioned the concept of planetary health, which was well received by the government policy makers. For conservative reasons, it was grouped under international collaboration terminology in the health adaptation plan. I think planetary health needs to really grab on to the climate change adaptation plans, because those are where the actual implementations are. And with implementation, we need to generate planetary health evidence. And the interesting thing about implementation is that they're often not designed as a randomized controlled trial, but they do happen because of societal movements, and we need to somehow turn the implementation into a quasi-experiment so that we actually know what works and what doesn't work, and what are the direct impact on health in the community, health cross borders, what are the indirect effects, what are the lag effects, and these are some of the technical research aspects that we need to bring into the national adaptation plans in the future.
Thank you, John. Jeremiah?
I think we have to be very contextualized. Start where it's easy. So if climate adaptation is the entry point, then that could be the easiest entry point. But I would just like to exercise caution that planetary health is beyond climate change. And often what might happen, and this is already happening in the COPs, is that climate and health has become a silo. So we have to avoid that, and we have to make sure that we bring in the whole issue around biodiversity loss, air pollution, but also the Anthropocene. It's human behaviors, the value systems that we have. I think that, as an Asian myself, I feel that our culture is rich, and I think we need to reflect back, just as on indigenous, culture. How do we take from our learning in our own culture, and how we advance planetary health, but just to be very, very careful of, creating silos again.
Thank you very much. May I invite Eric Ip from online?
Yeah, thank you very much. Yes, I would like to get to the point about East Asian culture. In fact, Confucianism offers rich resources for planetary health in Neo-Confucianism, there is an axiom that to be one with all things is to be humane. So to be humane is to be one with all things. And I think that it has a lot to offer to the Anthropocene. Another point that I would like to point out is that those working in environmental protection are not aware enough of health, whereas those working in the promotion of population health are not aware enough of the environment. And those working in other fields relating to environmental protection and or public health are not aware of planetary health as an integrated concept. So I think much needs to be done from an interdisciplinary perspective, and we can't tackle the climate crisis and biodiversity loss and air pollution from one single discipline or one single region. So cross-border collaboration, especially interdisciplinary collaboration, is simply crucial. Thank you.
Thank you very much. Personally, I think one of the most powerful messages from out of today's session was actually from Dr. Ip, from right to planetary health to planetary right to health, and emphasizing on the legal framework. That's really, really powerful. We used to tell we have enough evidence. Yeah, we have strong research, but enough is enough. We have to take action. And what is action? That is governance and law, actually. Without laws and enforcement, we cannot just continue another 30 years of campaign. We cannot wait. So I appreciate your contribution very much, Dr. Yip. And I think finally, Dr. Eb Chang, please.
Hello, everyone. I'm so happy to be the part of this event and to hear so many inspiring talks about the planetary health. In Taiwan, we try to promote transdisciplinary research and try to bring together the social scientists, the natural scientists, and stakeholders as well to working on this issue. But we think we have a lot to do. Yes, and I especially want to express my appreciation to Dr. Chiho Watanabe. And I want to say thank you to Eric Ip. Yes, same here. I think the policy making of it is really important for this issue. Yes.
Thank you, Dr.
Thank
Chang.
you.
So let me close the discussion session. I would not attempt to summarize myself, but just share my feeling. I think today, through the presentations and discussion, we confirmed we are sharing same sense of urgency, and we are basically doing whatever we can do. All this diversity, all different approaches, different way of work represent actually how, in a way, agile, flexible, and how quick we want to move. So I'm glad this World Health City Forum provides this opportunity for us. And we should not lose or miss this momentum. So we will continue our discussion tomorrow morning. Actually, the speakers and also representatives from the countries in the planetary health movement, please come to the room. I think the organizers assigned the room separately so that we can continue even from 8 a.m. That's difficult for me, but I will be there. From 8 a.m., we will meet in the room. You will receive an email confirming again. So we continue to discuss and more focus on actions, what to do in the coming months. Hopefully, we can organize Asia, East Asia hub, or just Asia Pacific hub sometime next year together. Thank you very much. Again, thank you so much, Dr. Sam Myers, for providing insightful keynote speech and also guiding all the work so far. Dr. Emila, it's wonderful that you are leading Asian group, and your Kuala Lumpur meeting was really crucial to come to this far. Also, thank you so much all the speakers for your contribution, and thank you to the audience, and also thank you to the MC. And back to MC, please. Thanks.
Thank you very much to all of our lecturers and here at the site here in Songdo, as well as who connected abroad. Also, thank you to the members of the Planetary Health Alliance's global community for their hard work. So why don't we give everyone another huge round of applause. All right, and our speakers may leave the stage. Now, with that, this concludes our first day of the second World Health City Forum. So thank you everyone for being here with us until the very end. Now, shortly, starting at 6:30 p.m., a welcome dinner will be held right here in the Grand Ballroom AB. And the welcome dinner will be a buffet style and will feature 2 wonderful performances. So I hope you enjoy the rest of the evening with us and also have a lot of networking with other participants. So I look forward to seeing you again at the welcome dinner. Thank you very much.